Order, please. The Subcommittee on Supply will now come to order. It is now 6:43 p.m. The Subcommittee in meeting to consider the estimates for the for the Office of Addictions and Mental Health as outlined in Resolution E28, resolved that a sum not exceeding $359,619,000 be granted to the Lieutenant Governor to defray expenses in respect of the Office of Addictions and Mental Health pursuant to the estimates. Resolved that a sum, I will now invite the Minister of Addictions and Mental Health. Sorry, there's one more, E17. Resolved that the sum not exceeding $6,960,000 be granted to the Lieutenant Governor to defray expenses in respect of Communications Nova Scotia pursuant to the estimates. I will now invite the Minister of Addictions and Mental Health and Communications Nova Scotia to make opening comments up to an hour, and if they wish to introduce their staff to the committee. Minister of Addictions and Mental Health and Communications Nova Scotia.
Good evening. Thank you, Madam Chair. So this evening I have with me Kathleen Trott, the Deputy Minister of the Office of Addictions and Mental Health to my right, and Barry Burke, the Executive Director of Finance and Treasury Board. I'd like to start by talking to you about the work we've been doing in addictions and mental health care in our province and our plans for the year ahead. Some of you may have heard me say this before, but it bears repeating. The commitment we made to Nova Scotians in 2021 on universal mental health and addiction care. It was historic. It is historic. Nothing like this has ever been done in Canada before, anywhere in the country. We were the first. We were the first to appoint a dedicated Minister of Addictions and Mental Health, a role I am very privileged to hold. And last fall, with amendments to the Health Services and Insurance Act, we became the first to pass enabling legislation to support universal access to mental health and addictions care. Being the first is exciting, but it's not for the faint of heart. Being the first means we didn't have a roadmap to guide us, a step-by-step plan. What we had was a vision for what we wanted the future to look like, a clear mandate from Nova Scotians to deliver on that vision, and a team of people at the department, in our health system, and in our communities across the province ready to dig in and make this happen. I was ready too, more than ready. I came from the front lines of mental health and addictions care right here in Nova Scotia. I saw up close and personal the impact access to care, or lack thereof, can have on people and families within our own communities. Our vision for universal care is one where every Nova Scotian can get the mental health and addiction services and supports they need when they need them. They are not limited by geography. They are not limited by whether or not they have private insurance or by their ability to pay out of pocket. And they are not limited by the issues they're facing relative to the issues that others can be facing. They shouldn't have to travel 5 hours. They don't have to pay hundreds or even thousands of dollars to receive care. And they don't have to wait for weeks or months or even longer. In a universal system, people who need care can get the care. So how do we do that? We do that by making a range of services available from a range of providers, scaled to meet the need of Nova Scotians. Our work is focused in 3 key areas. First, our traditional healthcare system, where we're expanding the programs and services we have in place now and adding new ones. Second, we're creating partnerships to tap into the skills and expertise of our universities, community organizations, and the private sector. And finally, integration, making sure all of that comes together. So when someone in our community needs mental health and addictions care, they just make one call, go through one door, and can be connected to the care they need. Whether it's from a clinician in a hospital, or a psychologist in a private office, or a local organization in their community, or a phone call with a peer support worker who has been through the same thing before. All of these services have a role in a universal system of care, and we are investing in all of them. Let me start with our formal healthcare system. The services provided by Nova Scotia Health and the IWK at our hospitals, at outpatient and community clinics, and through mobile clinics and more. Of the $65 million in new funding for mental health and addictions, almost 80% of it was invested in the public system. This is where you'll find our new mental health acute day hospitals, We opened one in Halifax in 2022 and a second one in Sydney late last year. Day hospitals can fill the gap between an inpatient stay and outpatient treatment. It is for people with complex mental health needs who need more support than what you get through an outpatient clinic, but also don't need 24/7 on an inpatient unit. And it's an option that didn't exist in the province before, one that gives patients the treatment and support they need during the day with the benefit of going home at night. People attending our day hospitals get care from a multidisciplinary team, one that might include a psychiatrist, nursing, social workers, occupational therapists, recreational therapists, and pharmacists. They provide care for Nova Scotians 7 days a week. We are opening 2 more day hospitals, one in Northern Zone and one in Western Zone, and this year's budget includes $2.5 million more to support that expansion. Once those 2 sites are open, the option will be available to Nova Scotians across the province within each zone. Another great example of the investments we're making in services and supports in our formal healthcare system is our recovery support centers. Recovery support centers offer a low-barrier way to access care and support for Nova Scotians who want to help with substance use, alcohol use, or problem gambling. And low barrier is very important because it's something we're seeing a growing need for in communities across the province. At our recovery support centers, people are supported by a multidisciplinary team that includes nurses, nurse practitioners, social workers, and navigators, where they can access treatment one-on-one, can take part in group programs, and can get connected through to other services like inpatient withdrawal, or opioid use disorder treatment, or community supports. We've opened 7 recovery support centers so far in Dartmouth, Sydney, New Glasgow, Middleton, Lunenburg, Evanston, and Yarmouth. 5 of those are fully operational. 2, Evanston and Yarmouth, are still building out their service offering, but their doors are open and they're providing care within those communities. This year's budget includes funding for 4 more recovery support centers: Halifax, North Sydney, Amherst, and Truro. And we have 1 more planned for Spring Hill in 2025. Both day hospitals and recovery support centers are filling gaps in our healthcare system and connecting people with healthcare in a new way, a way that did not exist before. That's what we're doing with our integrated youth services expansion. Over the next 3 years, we'll open 8 sites in locations across the province. IYS sites offer youth between 12 and 25 a safe place to get support for mental health and addictions, and other things as well. Training and education, employment, social services, life skills, and even recreation. At an integrated youth services site, youth and their families can access a range of different supports, all under one roof. The mix of services is different from community to community based on their unique needs. What doesn't change is the approach. Everyone works together. Here's a few other things I liked about this model of care. Integrated youth services sites are community-based, so they're closer to home. Because all the services are together under one roof, youth and caregivers don't have to travel to different locations for appointments and follow-up. Some of them are even open on evening and weekend hours. There's no appointment required. People can drop in anytime and get connected with someone that day. And of course, there's no cost. The first integrated youth service site is now up and running at the IWK in Halifax, and I'm looking forward to rolling that out in more communities this year. There's one more example I want to talk about from our formal healthcare system, and that's autism services. Budget 24-25 includes an additional $2.8 million to support the rollout of our new provincial preschool autism service. Demand for autism support services, like early intensive behavioral intervention, continues to grow. So does the waitlist for diagnostic assessment. The provincial preschool autism services expansion is one of the ways we're helping address the needs of children with autism and to support their families. What it means is that more children and their families can access more programs and services as early as possible. It means having one point of access, one waitlist for diagnostic assessment, one place families can go to access all the services and supports available in the province, in our public system, through community-based organizations and beyond. It means ensuring the Quick Start Nova Scotia program for toddlers is available across the province. It means having new autism intervention teams that will provide targeted, focused, and comprehensive services to children and youth with autism, based on the needs of that particular child and their goals, which are developed in partnership with caregivers and their families. It means increasing our capacity for diagnostic assessment. This is really important, because as of today, there are more than 1,600 names on that wait list. That's 1,600 children and young people, 1,600 families. And despite working at full capacity, I would argue even beyond capacity, in our public system, that list grows a little bit every month. We're adding more names than we're taking off. This isn't a new problem. What's new is finding solutions on how to fix it. Solutions like the pilot project we launched last year to connect children on the public waitlist for assessment with private practice psychologists with the training and expertise to conduct those assessments. We have 8 psychologists participating in the pilot at present, which is also helping us test the use of service codes to pay the private sector for delivering publicly funded healthcare services. And while that number is small, it is having an impact. In the first 2.5 months, we've been able to book 31 more autism assessments than we would have done otherwise. And we've booked 25 additional ADHD assessment appointments too, as part of this pilot. Again, these are names that were on the public waitlist for this service. Through this partnership with private practice psychologists, we're able to get them assessed faster. And we're working with community physicians through Project ECHO, extension of community healthcare outcomes, a globally recognized approach to building capacity in the community for specialty healthcare services. It's a model that allows us to support community-based clinicians to further develop their own skills, and at the same time, giving Nova Scotians better access to best practice care within their own communities. We have dedicated service codes in place that allow participating doctors to bill MSI for autism assessments through Project ECHO. We've had 14 physicians participate in training sessions so far, and we hope to bring more into this work in 2024. And doing more assessments means we can give people better, more timely access to the service and supports that come after getting their diagnosis. We're also adding resources to the teams at the IWK and dedicating resources within the team to do diagnostic assessments. That's in addition to recruitment underway for brand new roles in our healthcare system to support the provincial preschool autism program expansion, including the staff who will support the new province-wide clinical intake and care coordination system. Of course, diagnosis is just the first step. We also recognize the need for better access to services and supports for children and families once they have had a diagnosis. The services provided by Autism Nova Scotia and Hearing and Speech Nova Scotia, including EIBI, will continue to play an important role in this provincial program. We're seeing more children than ever come through these programs. And Budget 24-25 includes more than $20 million in funding to support that work. The services we provide through our traditional formal healthcare system, they will always be important because there will always be a need for clinical specialists delivering clinical care in a clinical setting. But hospital-based clinical care is not the solution for every person in every circumstance, which is why we're looking outside our public system at new ways to support Nova Scotians. Because mental health and addictions care is available in a lot of places, not just at clinics and not just in hospitals. It is available at private clinics where psychologists, social workers, and counseling therapists provide services to paying clients. It's available through our post-secondary institutions as we partner with them to create hands-on learning opportunities. It's available all across the province through community-based organizations who provide a range of services and supports for Nova Scotians. And increasingly, mental health and addictions care is available virtually, whether that's on the phone, by text, online, or through an app. We're going to bring every available resource to bear when it comes to connecting Nova Scotians to care. Private sector partners are already doing that. One example is the new mental health support program for firefighters that launched in December of 2023. Through a partnership with TELUS Health, we're able to offer volunteers the services and support that is often available to career first responders through employee and family assistance programs. Another example is Access Wellness, which we launched in 2022. It's a single-session counseling service for individuals, for families, or for couples. You can meet with someone online, by phone, or in person, depending on what your need is. And it's available free of charge for Nova Scotians. One of the things that I love most about Access Wellness is that it offers a quick and easy, low-risk, low-barrier path to service, therapeutic counseling that a lot of people have never even considered prior to this. Is a single counseling session not going to meet everyone's needs all of the time? Of course not. But in a universal system of care, it doesn't have to, because it's just one of the many services and supports available to Nova Scotians. For some, a single session with a clinician is going to be enough just for right now. For others, a single session with a clinician might help them see the benefit of a service like this to support their own mental health. Each of these services and many others we've launched since 2021 are helping to fill the gaps in access to mental health and addictions care. One of the most exciting things in this year's budget for me is the $10 million in new funding to support our very first insured service program for mental health and addictions care. When we talk about an insured service program, we're talking about a specific service by a specific provider at a defined rate of reimbursement. The autism ADHD pilot I referenced earlier, that's an example of an insured service program. Through that pilot, we're able to test and try the model to understand what is working well and what could work better. We'll take what we learned through the pilot, which is limited in scope and time, and use it to build insured service programs to scale so more people can access them. This approach to delivering care has existed for decades in Nova Scotia. It's how we pay doctors and dentists and pharmacists for the services they provide to Nova Scotians on our behalf. That part isn't new. What is new and what will make Canadian history this year is the launch of the very first insured service program for the delivery of mental health and addictions care. We're also supporting the work of community-based organizations, which play such an important role in our communities, as you all know, and who will play an even bigger role as we move towards universal care. Budget 24-25 includes an additional $6.7 million to create a funding framework for community-based organizations. Right now, most of our funding to CBOs across the province is done on a year-to-year basis. We do a lot of one-time grant funding as well. And you can imagine that makes it really difficult for these groups to do any longer-term planning. The funding framework is going to help us align the needs of Nova Scotians with the programs and services offered by CBOs. Not only that, but by transitioning to more multi-year agreements, we're actually giving the community sector something they've needed for a really long time: stability. So they can spend more time in the actual service delivery and less time doing paperwork for grant applications. Another key piece of the puzzle when it comes to universal mental health and addictions care is our work with post-secondary institutions. And we do that in a few different ways. First, they are key to ensuring we have the workforce we need to deliver health care to Nova Scotians today and for the future. Late last year, we announced the new Master of Nursing Advanced Practice in Mental Health and Addictions at Dalhousie University. That program will start in September this year. We also have the Center for Psychological Health at Dalhousie, where PhD-level psychologists are providing care to some of the most vulnerable Nova Scotians. The students are getting important hands-on clinical experience under the guidance of registered psychologists treating clients who really need it. That clinic is helping us test the use of service codes too, but in a different way. And of course, knitted into all of this and into the traditional public healthcare system are the ways we're leveraging technology to support Nova Scotians. As we move ahead this year, we'll keep looking for ways to use our finite resources in the best way possible across the system. When it comes to Universal, the third and final piece of the puzzle is systems integration. These are the investments and initiatives that are a little less exciting perhaps, but necessary to ensure we're bringing all these pieces together into one cohesive system of care. The work we're doing on integration now means that when someone gets connected to provincial central intake, whether they're referred by a primary care provider or self-referred, our clinical team does an assessment and can then connect them to any one of the services I've mentioned so far this evening. In public sector, by private sector, through community-based organizations, or through virtual care, we want to match people with the most appropriate service for their need. And to do that, we need to make sure those care pathways exist between services. The right service from the right provider at the right time. That's what universal mental health and addictions care looks like. The last piece I want to talk about is the workforce. Budget 24-25 includes $7.6 million to support our health and human resource plan for mental health and addictions. We know that under Universal we'll be delivering more care to more people. And to do that, we need to make sure we have not only more clinicians, but overall the right resources in the right place. This funding is going to help support recruitment and retention throughout the system. Doctors, nurses, psychologists, and social workers, to name a few. Plus all the non-clinical roles that support the delivery of mental health and addictions care, like peer support, engagement and outreach, administration, and more. It will help us add more seats in our healthcare-related post-secondary education and training programs and create brand new ones. And it'll help advance retention initiatives as well. So we're supporting the workforce we have today and keeping our new recruits in the system for the long term. By the end of this fiscal year, with our first insured service program out there and available, a funding framework to support community-based organizations, and a workforce action plan, we will have all the foundational pieces in place when it comes to universal mental health and addictions care. In total, we'll have invested $124 million more into the system, which means more services available more quickly to more people in more locations. This is certainly complex work, and there are a lot of moving parts. I said from the beginning that this is not easy, but doesn't make it any less important. And here's why. We've been given this mandate by Nova Scotians. It is their mandate, it is their priority. It's also their money, and they expect us, their government, to spend it wisely, to act in their best interests, to make smart investments in programs and services that are rooted in best practice, supported by evidence, and that we know will have the most impact. We aren't doing it alone. We're working with partners in the healthcare system, in the private sector, our community-based organizations, our universities and colleges, and many more. I just want to take a moment to thank the team, the Office of Addictions and Mental Health, under my leadership of my deputy and senior leadership. Certainly a passionate group that's been working very hard on a very complex file. I also want to acknowledge the many community-based organizations across the province that I've had the pleasure of working with and visiting over the last couple of years. So certainly from our public health care system, as doctors, nurses, master's level clinical psychologists and social workers, and many more. Since we started this work together in 2021, they have consulted with more than 200 stakeholder groups, including health system partners, post-secondary institutions, community organizations, regulators, colleges, professional associations, unions, Indigenous communities, and many, many more. The team has overseen expansions in our public health care system. They provided funding and guidance to community-based groups across the province. They've also built brand new innovative pilot projects from scratch. And all of that work is connecting more people to more care, and that's what's most important to me. Thank you.
According to the practice that is developed in this legislature, the opposition caucuses take turns asking questions for approximately 1 hour each. During a caucus's turn, the members within a caucus may take turns examining the minister on the estimates resolution. Only the minister may answer questions. Caucus is also expected to share time fairly with the independent member. To begin the examination, I now recognize the official opposition. I recognize the honourable member for Clayton Park West.
Thank you, Madam Chair. And thank you to the Minister. I jotted quite a few things, but my first question is, I see in the budget there's 36 million more in mental health supports this year. Is that correct? The total? Which is certainly, we're really happy to see that, the extra 36 million. And in the budget address, the Minister of Finance said the province will make progress on its commitment to offer universal mental health. That was in your opening remarks as well. But I also wanted to know, how are you envisioning, what is the final plan when you say we have universal mental health? What does that going to look like? It's like going to the family doctor whenever I need. How many hours are we getting? Can you give me the real vision for the future, and when do you expect this to happen?
I recognize the Honourable Minister for Addictions and Mental Health and Communications, Nova Scotia.
Thank you, Madam Chair. Thank you for the question. So I would say at a high level, certainly, access for Nova Scotians to high-quality evidence-based care for the care that they need would be this a simplistic version. Certainly, regardless of what illness or issue you're facing. Certainly no easy task, right, as I mentioned, for sure. So we really focused on really enhancing, I would say, the hospital-based system, right, with expansion of day hospitals, recovery support centers, certainly increasing access to virtual care in rural parts of the province as well. In terms of, I guess, the most significant aspects, I think, of the budget in regards to addictions and mental health care, you look at the $10 million for the health services insurance piece, which will be relating to the service codes, right? Which is really defined service for defined compensation, right? Essentially, so we made significant progress, I would say, in the service codes. We're actively engaged right now in conversations with various professionals in terms of compensation and scope of practice and sorts of unique infrastructure needs. So within the next year, there will be implementation of universal access in terms of service codes specifically. I think it's also important to note the importance of the community wellness framework, right? The $6.7 million. I think as MLAs, we all have groups within our own constituencies who do great work, right? And so a lot of times they do have impacts, whether it's with youth, peer support. They spend a lot of time, filing for grant applications and really can't focus on actually helping their citizens in their own communities. So as part of the Health and Human Resource investment of $7.6 million, we're not just focusing on the clinical and formal system, which we certainly will focus on that, but we'll also be focusing on peer support workers, on people that can do clinical outreach. So when you look at the Dalhousie Center for Psychological Health as well, really is a unique pilot, I think, offering high quality, low barrier access to folks who haven't really traditionally accessed the formal healthcare system. So if you look at these three buckets, right? You look at the high acuity based care of the hospital system, the non-urgent care with the service codes with the providers right across the province, and the community-based organizations. I think in the total picture, right, then you really get the picture of what universal access will look like. Thank you.
I recognize the honourable member for Clayton Park West.
Thank you, Madam Chair. Thank you, Madam Chair. I'm still not getting the picture. So the recovery centers, we're opening them in different regions. So as a new family with small kids, is mental health going to happen in the school, or just what is the vision, and are there other provinces or other jurisdictions across the world who have achieved universal mental health that we're following? What is the true vision for me, for my daughters in the future? I would say, they're going to have, just like, is it separated from the family doctor? These are, if you have mental health, you don't go to your family doctor, you go here? Or what is the real vision of how the access is going to be?
I recognize the Minister of Addictions and Mental Health.
Yeah, see, I think the real goal is system integration, right? So there's no wrong door, right? So this would be the right provider at the right time. Certainly with schools specifically. We are developing the curriculum with collaboration with the Department of Education and Early Childhood Development. So that will actually be piloted in specific schools this spring, with the goal to roll that out next year across the province for I think it's grades 6 to 9. We also support Schools Plus, youth health centers within the school system specifically. But to answer your question, like the goal would be a single point of entry to the system to get the right care at the right time, is how I would describe it, right, based on best evidence. Thank you.
I recognize the honourable member for Clayton Park West.
I'm not being difficult. I'm just trying to really envision it. So, and I'm trying to also envision how the system is going to work. So this child, if I had a child who had mental health or autism, do I take him to a recovery center for just mental health, and then for everything else, he goes to the family doctor, and then for hospital for whatever? How are these connected? How is that information being shared from the recovery center to the hospital to the family doctor?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I think that's a good question. Certainly something I saw when I worked in the system. It's a real, navigation can be a really challenging issue, I would say, for families, right? So I think if you look across some of the services that we've kind of talked about tonight, like the recovery support centers, I guess specifically, are primarily geared for like substance use and gambling kind of issues, right? Or low barrier access for communities. So I think what we're really working towards, which has really been lacking, not just in Nova Scotia, but I would say in Canada, right, is having that single point of access for evidence-based care, right? That can vary depending on the specific need of the individual, right? So I certainly wouldn't say that going to your primary care provider would be the wrong place to go. Certainly they may not have the skills or the clinical, ability to, but they should have they will have an avenue to where to direct that person for the right care based under this model.
I recognize the Honourable Member for Clayton Park West.
So what I'm hearing is similar to going to see a specialist. You've got to go see your family doctor to get to see a mental health specialist. Is that correct? And if that is not self-referral, I can't just call or be included in and how many sessions will that child receive, or that mental, how are you assessing the needs and who decides that?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so the best point of, I guess, touching base, if you have addictions and mental health care, certainly the central intake system. The central intake system, the phone number, they have highly skilled and qualified clinicians who will do a very thorough intake. I think last year they did close to 16,000 calls for Nova Scotians. And certainly every person, based on their unique needs, would certainly have a different level of acuity and would need a different number of sessions, right, based on their unique situation. So in terms of specific, I guess, categories of treatment, just using examples, right? So if you look at the neuropsychological, assessments or psychodiagnostic assessments, it could be individual therapy, it could be family therapy. So these are the sorts of services that clinicians can provide. So you don't necessarily, most of the services that we'll have, for example, the Tranquility is an online resource, just as an example, that uses internet-based cognitive behavioral therapy. So anyone that needs care can self-refer. But I think some people, based on stigma and based on other reasons, primary care providers also will have to have a clear pathway to refer to the system. And I know those conversations are certainly ongoing in terms of the integration piece. But the goal will be that there'll be no wrong door, right? It's self-referral. It's with your primary care provider. It could be online. It could be virtual. It could be telephone, right? Just a really wide spectrum of ways to access the care that you need.
I recognize the Honourable Member for Clayton Park West.
Thank you, Madam Chair. I can't say I'm really clear on the vision and how we're going to manage to this and how people are going to know that these access points and how to get their children or their adults. But how many people are waiting for assessments? Do we have numbers? We received 16,000 calls last year. How many of them were able to get appointments? And what's the waiting time?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so just just, I think it may be helpful just to kind of go over I have some data here for I think there's some important numbers. So in terms of the provincial crisis line, Kids Help Phone, Nova Scotia Health Crisis Consults, so for 22-23, there was 55,186 total intakes for crisis. Certainly, Nova Scotia Health, just to give you an idea of the sheer volume of appointments, had 397,765 appointments in 22-23, just in terms of volume. In terms of obviously addressing wait times is certainly a significant issue and something we keep a very close eye on. We do meet the urgent wait times quite consistently within 7 days. Our real challenges, I would say, in the province are with non-urgent wait times. So that's why we're really working hard to really implement low barrier access forms of treatment. Certainly, whether that's an outpatient clinic, whether that's through a community-based organization, and other forms of kind of middle to lower tier forms of treatment. I'll ask my staff to see if they can find the specific non-urgent wait times for you, and I'll follow up with that shortly, if that's okay.
I recognize the honourable member for Clayton Park West.
Thank you, Madam Chair. Yes, if I can have the numbers of people wait on the wait list, that would be wonderful. Also, I have a question here. The Canadian Alliance on Mental Health Illness and Mental Health recently did a nationwide survey and gave Nova Scotia a failing grade in every single category of our mental health and substance use health system. That's an F in access to public confidence, satisfaction, and effectiveness. What are you doing? What's in this budget to ensure that Nova Scotia can access care that they need and improve this F rating? Access.
I recognize the honourable minister for addictions and mental health.
Yeah, so certainly we've invested, more than $65 million into mental health care so far. So certainly it's not just about money, it's also, I think, strategic planning and implementation. So I do think this has certainly connected more Nova Scotians to care that they do need. So if you look at, what we've done, for example, for expansions of the opioid use disorder treatment, the mental health clinics across the province, expansions to peer support, expansions to autism services, withdrawal management. And there's also new services like the mental health acute day hospitals. Certainly 20% of this also went to, increasing services and supports through various pilots, and also working with CBOs. So we're also doing some significant work with online access to e-mental health resources and virtual care in emergency departments in rural parts of the province. So certainly I haven't seen that specific study. I don't know what their sample size was or the specifics. But I would certainly say we're making significant investments to improve access to care.
I recognize the honourable member for Clayton Park West.
I'm surprised that the minister hasn't seen or heard of the Canadian Alliance on Mental Health report. I have I can forward that to you if you would like. I also wanted to ask maybe some questions on the actual budget. I see that in general administration in 23-24, it was 186,000, and we've spent almost double that, 331, and you're increasing it to 454, which is wonderful. But if you can let me know, what is this going to be spent on? Is it salaries, the 454,000 for general administration?
I recognize the honourable minister for addictions and mental health.
Yes, that would be for a new position and salary. Yeah, thank you.
I recognize the honourable member for Clayton Park West.
Thank you, Madam Chair. Sorry, how many positions did you say?
I recognize the Honorable Minister for Addictions and Mental Health.
Two, so it'll be Deputy Minister and the Special Advisor. Yeah.
I recognize the Honorable Member for Clayton Park West.
Thank you. The next line I'm reading here as well is strategic direction and accountability. Again, we had budgeted in 23-24 $2,894,000, and it went up. Less was used, but now we're increasing it. I'm just wondering how this is going to be spent. The 31,562. Was it? So is that 31 million when you put 3 zeros? Yeah. 31 million, I guess. Sorry, that is for the early intervention services. I apologize. Right? The 31 million? So the amount spent was less than what we budgeted for, but we're increasing it again.
I recognize the Honorable Minister for Addictions and Mental Health.
So yeah, in terms of the early intervention services budget line items, the bulk of that is from provincial preschool autism services, Nova Scotia Health wage increases, and IWK wage increases for staff. Thank you.
I recognize the Honorable Member for Clayton Park West.
Just one more, and then I will pass it to my colleague here as well. We have mental health services line, and I believe we're spending less on that line, the mental health services. Am I reading it correctly? It was 222. We spend a little more, 231, and we're increasing it, correct?
I recognize the Honorable Minister for Addictions and Mental Health.
So yeah, so the original number was 222,122, and it increased to 268,821. Thank you.
I recognize the Honorable Member for Clayton Park West.
And what is this going to be spent on, if I may ask?
I recognize the Honorable Minister for Addictions and Mental Health.
Yeah, so the bulk, I guess, of 36.2 is for the Addictions and Mental Health is currently examining a model for response to crisis mobile response teams across the province. There's the Dalhousie Clinical Psychology Training Program, so it's the Center for Psychological Health. There's funding in there for the Master of Nursing Advanced Practice in Mental Health and Addictions at Dalhousie University. So there's $7.6 million there for the Health and Human Resource Strategy, $10 million for the HSIA, so the Health Services Insurance Act program, and $6.7 for the Community Wellness Framework, which will provide multi-year core funding to community groups that deliver, I'd say, low to moderate kind of tiered services for mental health care. Thank you.
I recognize the Honorable Member for Clayton Park West.
Thank you, Madam Chair. My next question is the recommendation on page 60 of the Mass Casualty Commission report recommends that the province of Nova Scotia should establish a comprehensive and adequately funded model of mental health care services provision for urban and rural Nova Scotians. This model should include first response to those in mental health crisis and in continuing community support services to prevent mental health crises from arising or reoccurring. What specifically in this budget will ensure that Nova Scotians can get the mental health they need no matter where they live?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so one of the most significant, I would say, recommendations that came out of the mass casualty report was recommendation C13, which really focuses on improving access to mental health care for folks in those impacted regions, both through Nova Scotia and through the Government of Canada. So certainly I'm working with my second federal minister now, we're definitely, I'd say, certainly working collaboratively on this issue. So in terms of, like, I guess, deliverables and what we've been doing to kind of implement those important recommendations. So Nova Scotia Health has hired 23 new roles, so within those communities. So they range from frontline clinicians. There was a number, one specific position with a registered nurse who's kind of out in the community as like a navigator, touching base within the community. A variety of folks working within health promotion and public engagement. Most recently, we did announce the implementation of a community grief and emotional bereavement model, which will start within the northern zone. Then over the next couple of years will be expanded province-wide. So we do have a couple subject matter experts that have been hired to kind of lead that model as well. So I think there's already been a needs and impact assessment done in 2023. Still be another one done in 2025 and 2028, just to basically quantify if we're actually doing what we're trying to do within the community. We've also made significant investments in trauma-informed care to service providers and those who are interested in kind of getting the care within the community. So I would say it's very much a whole of government approach, right? So the Department of Justice is certainly involved, the community services, communities, culture, tourism and heritage, and primary health care. At one point we also did mobile primary health care clinics with mental health resources embedded within those as well. So certainly really listening to the community, really letting them kind of help guide us and support them. But I do think we have done a lot given the mandate. Thank you.
I recognize the Honourable Member for Clayton Park West.
Thanks, Madam Chair. That makes the two of us with our throats. Not that I understood the total vision for this universal mental health, but I would like to ask, when can Nova Scotians expect universal mental health and addiction care to be implemented? When would you expect that? Is it going to be 2024, 2025? Where is it? Where are you with it, and when do you expect it to be saying we have implemented it?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I would say the first stages of implementation will be within the next year, and this will take a while. Like this is very complex, right, and comprehensive. But the first province-wide scope of implementation will be within the next year. Yeah.
I recognize the Honourable Member for Clayton Park West.
Thank you, Madam Chair, and I'll pass it on to my colleague here.
I recognize the Honourable Member for Bedford South.
Thank you, Madam Chair. Thank you, Minister and staff for being here tonight. I really appreciate that. I just wanted to ask a question about firefighters, volunteer firefighters in particular. So I was a substitute at the Human Resources Committee maybe about a month or so ago, and we heard from volunteer firefighters in particular that obviously they're in a high stress environment that can often lead to mental health issues. Obviously that was one of the reasons why the province provided coverage for paramedics and other groups as well. And of course volunteer firefighters deal with many of the same issues. I know that there was some funding referred to in the meeting through TELUS. I'm just wondering what is happening in terms of volunteer firefighters with coverage, and how much is being spent. I believe it was through TELUS. If I'm wrong, I could be corrected. But how much is being spent through that program? Thank you.
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so that specific program was certainly something that kind of came up at conversations after the natural disasters with the fires and the floods. So I guess during those events and post events, we kind of deployed mobile mental health teams, like to comfort centers and kind of different community resources and hearing from different MLAs and, folks across the province, it was certainly, I would say, an identified need that they felt that they needed. The first was this volunteer firefighters, and it's also for ground search and rescue folks too. So $75,000 over 2 years for the pilot. So it offers, it can be in person, it can be virtual, it can be telephone. I also believe there's options there for kind of family kind of therapy, right, if need be. So I think this has certainly been working with the president of the Volunteer Fire Chiefs Association. Certainly something that he wanted. He was here in the legislature last session. So yeah, just a few things that it does: family and couples therapy, stress management, addictions and substance use support. It can also get some primary care advice, for diabetes or hypertension, kind of workplace sort of comorbidities, I guess you would call them. So I think it's certainly been well received for most. I have 13 volunteer fire departments in my own constituency in Cape Breton. So the big piece now is to try to communicate that it's available to your fire departments within your own communities. So I would certainly encourage folks to do that.
I recognize the honourable member for Bedford South.
Thank you, Madam Chair. Thank the Minister for that. So a 2-year pilot program, this is the second year coming up? Is that right? This fiscal year would be the second year. And once the pilot project is complete, what are the options beyond that for mental health supports, specifically for volunteer firefighters, ground search and rescue, and so on? Thank you.
I recognize the honourable minister for addictions and mental health.
Yeah, so the actual program launched December 15th of 2023. So it'll be 2 years from that date. We'll certainly, be evaluating the outcomes and seeing, what we're getting in terms of metrics. It'll be also important to talk to the volunteer firefighters and their families to see if they find that is the service helping. I think we've already had some initial feedback from various chiefs that they do find it's a very positive thing now that they're getting, whether it's literature in the fire departments for folks to call the number or use the website, or kind of a confidential way to kind of seek help where folks might, not otherwise, right, do so. So this is a pilot though, like it's intended just to better understand the needs, right, and to see if it's actually helping. But it can be a very, I'd say, volunteer firefighters usually work in other full-time jobs. They have a lot of demands on their time and energy and these sorts of things. So I think it's just another point of access. But we'll certainly make sure that we're getting, a good outcome for what we're investing. Yeah, thank you.
I recognize the honourable member for Bedford South.
Thank you. And Madam Chair, I just want to make sure I have my timing right. When is our hour?
8:06.
8:06. Okay, that's what I have. Okay, good.
I will give you a 5-minute reminder.
Okay, thank you. Minister, one thing that I've been curious about ever since the announcement of the Universal Mental Health Program, which we all want to see happen, we'd love to see that. And I'm certainly not an expert in the field, so forgive me if this is obvious, but if you're a psychologist in private practice today, and you have a full client roster and you charge, I don't know, $200 an hour, $150 an hour, whatever the case might be, and then a public program comes in where you might not be able to charge as much, or I don't know if that's the case or not, but I'm just wondering, how does the department plan for that to make sure that the private option that many providers are already doing is not really the only option for them? And they'll say, well, look, I'll do as much of the public work as I can, but I also can't cut my income in half. How does the department plan for that? How does that fit into the overall framework of this project?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, certainly a good question. It's certainly a complex question to answer for sure. So, I mean, we've had, I would say, hundreds of conversations with various clinicians. I guess the key groups of clinicians that we've been talking to thus far have, focused on psychologists and social workers, nursing, occupational therapy, registered counseling therapists. So I would say we've had significant engagement. We've actually had a significant increase, just for example, with the number of registered counseling therapists actually coming to Nova Scotia, which I think is a very positive sign, right, in terms of recruitment. In terms of the working, I guess, in the hospital-based system versus having a private practice, I've certainly worked with clinicians who do both. Some might do, work on an acute, psychiatric ward during the weekdays and have a private practice during off hours, for example, just as an example. So with these service codes, we could tap into that kind of additional capacity as well. Certainly, there'll have to be, I would say, fair and equitable compensation, right, for the clinicians. And I think if you look at what we've done so far with physicians, nurses, and paramedics, there's always conversations that are fair and take place kind of at the collective bargaining table. And it's not just necessarily private practice. Like if you look at the Center for Psychological Health, just for example, at Dalhousie, these are folks that are actually being, referred from CBOs right in the HRM, or some folks just walk in right off the street, right off the campus, and get high quality service right on the spot. So there's definitely certainly a role for CBOs and I think post-secondary institutions as well. We did invest to have a research chair for addictions and mental health too at St. Francis Xavier University in Antigonish, for an example. So I don't think that position has been chosen yet, but that'll be coming soon. And they're really going to have a focus on rural mental health care in Nova Scotia because it certainly has unique needs as well. So certainly, I wouldn't say the private and public are mutually exclusive, right? So you can do both. There's always professional choice too as well, right? So, but we're certainly, and we have a significant investment of $7.6 million for HHR specifically for Universal in this budget as well. So it's not just for hospital-based clinicians, it's right across the spectrum. So I do think that will make a significant difference. Yeah, thank you.
I recognize the Honourable Member for Bedford South.
Thank you, Madam Chair, and thank you, Minister. And I also wanted to touch on something you mentioned there, which is recruitment, of course, which is always a hot topic in all fields, but particularly in healthcare over the last little while. And I just was curious about how that fits into the picture. So if, in a perfect world, obviously, if universal mental health care was in place tomorrow or 6 months from now or, soon, do we have the people, I guess, to do the work? And if we don't, how do we go about making sure that they are there when the day comes when hopefully we can say that we've achieved this goal?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so I would say certainly recruitment certainly can be a challenge, but I would say since 2020 when we had, I would say, pretty significant success with different disciplines, right? So since 2021, we have a net new 148 mental health and addictions clinicians. So this is just for Nova Scotia Health. So these would be folks that are working in either inpatient or outpatient mental health care within Nova Scotia's health system. So 71 net new nurses, 21 net new LPNs, 29 net new social workers, and 14 net new counseling therapists. We've certainly had challenges with psychologists specifically. I would say, not too long ago, there was significant challenges too with psychiatry, specifically in Cape Breton. So certainly we have significant improvements with that right now. I think in the province we only have, I think, 4.1 vacancies right now for psychiatry for 164 psychiatrists. So I spent a lot of time recruiting some myself at times, to be honest, and we've been very successful to get a number of families coming, not just to Eastern Zone, but I would say to Northern Zone and other areas of the province with their families, and often they come with colleagues as well. So now in Eastern Zone, we have, I think, a full complement of psychiatrists for the first time in 15 years, right? So there's been some positive stories. So I think you can definitely turn the ship around, right? And I think certainly psychologists will certainly be a focus of mine as the ministers, whether that's working with folks in advanced education in terms of seats, but we also have to focus on immigration and kind of streamlining credentials, right? So the impacts that the Patient Access to Care Act has had on international recruitment has been significant. I don't think that'll be the same as far as mental health care as well. Thank you.
I recognize the honourable member for Bedford South.
Thank you, Madam Chair, and you must be a good recruiter then, Minister. Good job. On the psychologist side, how does that look in terms of vacancies versus positions at this point? Thank you.
I recognize the honourable minister for addictions and mental health.
So the current vacancy for psychologists right now is 28.4.
I recognize the honourable member for Bedford South.
Thank you, Madam Chair. And just how many overall positions? So 28 of how many possible positions?
I recognize the honourable minister for addictions and mental health.
So 74. Yeah.
I recognize the honourable member for Bedford South.
Thank you, Madam Chair. I appreciate that, Minister. So quick math, that might be, I don't know, 40% or so. So I take your point there in terms of vacancies. That's certainly a challenge. I appreciate the time and the answers there from the folks. I'm going to pass things over now to my colleague from the NDP, the MLA for Halifax, Citadel, Sable Island.
It is now time for the NDP's turn. I recognize the honourable member for Halifax, Citadel, Sable Island.
Thank you. And thanks so much to the Minister and staff for being here and answering so many questions. I, of course, have a number of questions, and I'm just trying to decide where to start. But so one of the things I did want to talk about is, in Nova Scotia, we have very limited public data about how Nova Scotians are doing in terms of mental health and about services and sort of where they're at and the outcomes of those services. So one of the only ways that people can gather information is the wait times registry. And, I guess what I have noticed, so I went and downloaded all of the wait times from the most recently reported piece of data, or data period. And of that, so between adult services and youth services in all of the sites, there were only, I thought there were 3. I can only find 2. There were only 2 or 3 that actually showed a decline in the last reporting period. And in fact, all other jurisdictions are showing an increase in wait times, both for adults and youth, and for 50%, first time, the wait time for 50% of folks versus 90% of folks. And I can't wave these in the air because that would be a prop. So, so for instance, I'll just walk through a couple of them before it gets really terrible and painful. So the Halifax Bears Road Clinic, for instance, for adults. So whether I take the wait time for 50% of folks or the wait time for 90% of folks, the trend is basically the same. And the numbers are increasing. So they've been increasing since the fall of 2022. there's other places where in the public available data, there's huge gaps. So the rural Cape Breton clinics have data publicly reported for 2021, October 2021 to June 2022. And then they have another little blip over here in January to March 2023. So it's quite an empty data set. Guysborough and Antigonish showing a steep increase from October 2022. Yarmouth Regional at the 90% is showing a sharp increase from the same period. Cumberland County also increasing. Anyways, and the IWK for child and youth mental health is extremely hard to understand, and I think there's an error in what's been posted, and I have tried to bring this to the attention of your department, and no one seems to have noticed it or dealt with it. But the graph goes like this. So, so it goes from, the wait times for 50%, July to September 2021, 59 days. July to September 2021, 6 days. October to December 2021, 7 days, but then there's a doubled count here of October to December 2021, 54 days. And then it goes to 4 days, 68 days, 5 days, 62 days. Anyways, do you get the idea? The data's, I think, obviously incorrect. And it's been like that since last summer. And these gaps in the data ranges that I've been talking about, where there's like a little bit of a graph and then there's a blank space where the data isn't reported. Anyways, when this is really the only, one of the only sources of information we have publicly available about how the mental health system is working, both the gaps in data and whatever is happening with the IWK data and the fact that it's been up there for 9 months is all concerning. But what's more concerning is that most places are showing an increase in wait times. So I'm wondering what your goal is in the next year, this coming fiscal year, in terms of wait times in Nova Scotia.
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, thank you, Madam Chair. So I did know about the graph or the discrepancy, so I'll look into that and I will follow up with you for sure. Yeah. So certainly in terms of, I think it's important to note that we are meeting the targets for urgent care in the province, certainly when folks are really kind of the most acutely ill. Non-urgent wait times certainly are very challenging given the increased demand and I think acuity and complexity of cases. So this year is really certainly focusing on initiatives that will increase access to care for non-urgent issues, such as the integrated youth services rolled out over the next couple of years. We made significant investments in virtual care in rural parts of the province. And really this year we really are focusing on the non-urgent investments. So certainly with the service codes and the community-based organizations, they can really play a vital role in those lower to middle tier type of services within the communities. So recovery support centers, I think as an example, really where people can just walk in off the street, really low barrier access is important. So we certainly do agree that the evaluation and monitoring is very important. So there is frameworks that have been developed for universal access initiatives, and also for universal overall. So many of these frameworks, for example, the Center for Psychological Health, are fairly early stage, but there's very detailed monitoring and evaluation to really ensure that it's increasing access to care for folks. And people are really happy that it's people-centered care, that it's safe and effective for folks. Thank you.
I recognize the honorable member for Halifax Citadel Sable Island.
And Minister, I'm not sure if I heard correctly. So you said that you're meeting the timelines for urgent care, but not urgent wait times. Is that what you said? And if that's what you said, can you clarify?
I recognize the honorable minister for addictions and mental health.
Yeah, I just said that we're meeting the targets for urgent wait times, and that non-urgent wait times certainly remain a challenge. But many of the initiatives, I would say, announced in this budget and previous budgets are really geared towards increasing access for non-urgent care.
I recognize the honorable member for Halifax Citadel Sable Island.
And what is the goal for non-urgent care?
I recognize the honorable minister for addictions and mental health.
Yeah, I know, just having worked in the system, typically that was 28 days for non-urgent care. We would certainly like for that to be much less than that, for sure. I mean, right now, to be honest, we really want to see a decrease in non-urgent wait times, right? So that's why I'm really working hard to increase access right across the spectrum. So certainly we'll continue to monitor wait times very closely, and we'll really know as we kind of move forward with implementation. There would certainly be an expectation by myself that these would start to decrease.
I recognize the honorable member for Halifax Citadel Sable Island.
So one of the other publicly available data points around mental health in the province is around suicides. And 2022, we had the highest rate of suicides we've ever seen in Nova Scotia. And I know when that was released this past September, the department indicated that there would not be a suicide prevention strategy. You know, and I'll just say that what I hear through community, so, you know, from parents who've contacted me, community advocates, is that that number is probably low, that often suicide, they feel that their young people's suicide was misreported, I guess the word would be. So, but let's just assume it's still the highest rate, it could be higher. So how are you addressing this?
I recognize the honorable minister for addictions and mental health.
Yeah, certainly suicide is a very complex and it could be a tragic issue for families and communities, certainly in Nova Scotia. I know in 2020, the province did implement suicide prevention and risk reduction framework. Right now, I'm certainly having very active conversations with the federal minister on the rollout of a national suicide framework. I do feel there's a real sense of urgency on rolling this out nationally. So that's really being led by the Public Health Agency of Canada. We're certainly part of those conversations on a national suicide prevention action plan. There was also recently the rollout of 988, so the suicide prevention crisis line. I think we do have some metrics on that here, but I can get them for you shortly, but I know there's been pretty significant uptake from Nova Scotians using 988. We also had a men's mental health campaign earlier last year, just really focusing on the demographics that are at highest risk for suicide. So I think the national suicide prevention plan will certainly be important. And we certainly keep a very close eye on access to crisis services as well. So I know last year, I think that the crisis line received close to 27,000 calls. So these are people who are getting very quick access to a trained clinician who can navigate them through the system. So certainly an issue I'm aware of, and it's a very complex issue, but something we're working hard to address.
I recognize the honorable member for Halifax Citadel Sable Island.
Thank you. And I mean, you know, I agree, it's an urgent issue. I know that FAC has been working on that strategy and action plan for a long time, actually, and I was engaged in earlier research around this. So it's good that they're looking at it. It's just it is actually taking a long time. Do you have a sense that we'll see it this year? And in the absence of that, do you endorse the 2020 framework that was released around suicide prevention?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I would say certainly in terms of conversations with the federal government, we're very actively engaged. Certainly, I would say it's a very collaborative relationship that's being worked on very hard. I think a critical part of this is also we have very, I would say, strong public health surveillance in Nova Scotia. Certainly something we keep a very close eye on. I know, as you mentioned, suicide can be very complex, even in terms of reporting. So there's certainly, it can be a very complex issue. I know there's certainly elements of the framework that I certainly would support in 2020, but I'm always looking at best available evidence to improve things.
I recognize the Honourable Member for Halifax Citadel Sable Island.
I wanted to ask about integrated youth services. As you know, I'm a big fan of the model and a big advocate. And so I'm wondering, in this coming fiscal year, how many sites will be opened? And I have a less sort of direct question. So I understand that a number of Indigenous communities and the Mi'kmaq Native Friendship Centre provide a letter to the department expressing concerns about the process of site selection and engagement in the Integrated Youth Services project. And I'm wondering if you could speak to how you're addressing that. I wonder if the minister could speak to how he's addressing that. It's like a conversation.
It flowed. I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I know the IWK is leading those conversations with those communities, so I certainly don't have that information here now, but I could certainly look into the letter and to see if I can follow up with the member. Okay, so that's okay.
I recognize the Honourable Member for Halifax Citadel Sable Island.
That would be great, and I think it is important. I mean, there has actually been a lot of work nationally around building capacity in terms of Indigenous models of IYS, and through the federal IYS net, there is an Indigenous council around that work. I can't remember the name of their actual working group. So, yeah, I think it's, you've spoken to the importance of having community engaged and the importance of community in supporting people's mental health, well, in community. So we need to be getting this right with community members. And on the issue of community, so I have also the CMHA Nova Scotia's response to the 2024 budget here. And they're actually saying that they're disappointed in what's available for community mental health. So the headline is, Nova Scotia Budget 2024, budget acknowledges of rising cost of living, not enough for community-based mental health. And so, they feel their efforts, the government efforts fall short in supporting the important work of community-based organizations in support services. Quote, we are disappointed that this budget does not include the critically needed investments we were looking for to address the social determinants of health. Community-based organizations are filling the gaps, meeting people where they are. I mean, that's definitely the role and the value that you spoke to. So they were looking for further support, and I'm wondering for community-based organizations in mental health, and I'm wondering what your response is to that criticism.
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, certainly we've supported the CMHA in the past. I have a lot of respect for the work that they do, certainly in the province. I mean, if you look at the increased investments in mental health over the last 3 years, I mean, they've been by far the largest investments in the history of the province, right, to be honest. So I certainly, I spent a lot of time myself working on pushing the community wellness framework forward. I mean, I've visited many CBOs across the province. This was a very specifically identified need. So I would say that's in a historic investment in core funding for CBOs in the province. You certainly can't please everyone all the time, right? But I have a lot of respect for the work that the CMHA does. I do think there's significant, if not historic, investments in mental health care. I didn't read that specific report, but I'll certainly take a look at it as soon as I can. Thank you.
I recognize the honourable member for Halifax Citadel, Sable Island.
And I do think providing multi-year funding for community-based organizations is an excellent step forward, and I think is important across all sectors from all departments. But I guess what CMHA is talking about is that they just found that there was not enough investment and spending on programs. So I can give you this for you to take a look at if you'd like. They are a major stakeholder, both in sort of thought leadership and community mobilization around mental health, and obviously programs. So I think it would be good to engage with them on their concerns. So I don't know. Was that a prop? I hope not.
I recognize the honourable member for Halifax Citadel, Sable Island.
In the government business plan, there was a reference to increased addiction services, increased attention to safe supply, and increased numbers of overdose prevention sites. And I'm wondering if you could talk about what the goal is for this year in terms of how many new OPS and what that safe supply policy looks like.
I recognize the honourable minister for addictions and mental health.
Yeah, so I guess in terms of safe supply, there's a pilot right now with the North End Community Health Center, so it'll be tablet safe supply with opioids. So they're kind of undergoing that pilot right now, so we'll certainly get the outcome data and reports on that specifically. We do have 2 overdose prevention sites right now in the province, one here in HRM and the other one's in Sydney. Certainly have seen increased demand, I would say, in both, in terms of, whether it's syringes or whether it's, supervised consumption. We've been also noticing, increases in accidental, overdoses, toxicities, real significant issues with synthetic opioids, synthetic benzodiazepines, right? So not only are people kind of using it in high-risk situations, they're actually poisoning themselves to the point where there's overdoses. So certainly something the folks in the office, and certainly Dr. Hickox and Dr. Strang, really keep a very, very close eye on. If you look at what's happening out in Western Canada, it's quite catastrophic. What's happening out there with the opioids and issues like that. So there's certainly emerging evidence, I would say, in terms of safe supply, specifically of tablet safe supply. I know British Columbia is kind of in early days of looking at the research for injectable opioid agonist therapy right now, given their epidemiology, right? They're having some serious issues. So certainly we keep a very close eye on that. I'll be curious to see how this pilot goes. There's also an issue too in Nova Scotia. We have a very select group of prescribers in the province. There's only a handful right now. So there's certainly a clinical, professional, probably education, aspect to that as well. We did launch a addiction medicine consult service here at the Halifax Infirmary. So I'd say it's incredibly been positive feedback. So an emergency room physician or a med-surg doctor on a med-surg unit can refer to an addiction medicine consult specialist. Because oftentimes these folks, through intravenous drug use can, have heart infections and different other kind of issues. So I think that's a very positive service that's been launched, and certainly something we'll look to expand if we can find the clinical clinicians to do it. Thank you.
I recognize the honourable member for Halifax Citadel, Sable Island.
Thank you for that. And yes, obviously the poison drug supply and accidental overdoses is a growing issue, and we don't want to end up with the kind of stats that we see in BC and Alberta. I will just say that in the government business plan, it says that the government is going to open more overdose prevention sites. And I can show you that in the house. My government business plan is in the other room. So perhaps if you're not familiar with that reference, that commitment in the budget, you can have a look at it and follow up and let me know how many sites you're aiming to open.
I recognize the Honourable Minister for Addictions and Mental Health.
I can follow up. I'll see what that is. Yeah.
I recognize the Honourable Member for Halifax Citadel Sable Island.
I'm wondering, in the budget, how much is allocated for the development of an alternative emergency mental health response program? Like the new models of care to enhance interactions between police and persons experiencing mental health and addictions crisis in the community through a community-led crisis response model as per the business plan.
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so the increase this year is $675,000 for the mental health and addiction model for response to crisis within the communities. So the total for that would be 2.25. So this is really looking at, I guess, supporting a framework, examining a variety of mobile crisis models. So some of that will be with no police, some of it will probably be with police. So there'll be a variety of things kind of looked at there. There's been pretty significant consultation across the province. We'll also be examining the ability for first responders, whether it's police or paramedics, to have direct contact with a mental health clinician, like when they're out on a call. So that's kind of what we've been looking at. We just have to be very strategic in the terms of we'll have to have the ability to expedite it or kind of decrease the acuity, right, depending on what happens on the calls, right? Because sometimes, depending on what's happening, you certainly might need a police officer for safety of the patient or the staff, right? So, but we're looking at, I know we looked at jurisdictions across, certainly across Canada that have done this, I think, quite successfully. We've certainly have some communities that have been very interested in terms of the police service and the folks working within the healthcare system. So this is really to create the framework across the province for crisis response. Yeah.
I recognize the Honourable Member for Halifax Citadel Sable Island.
So will the framework be rolled out in this coming fiscal year? And you've mentioned communities who are interested. So certainly I know that HRM Council is looking at fast-tracking the development of their alternative emergency mental health service. But what other communities have expressed interest directly to you?
I recognize the Honourable Member or Honourable Minister for Addictions and Mental Health.
Yeah, so the framework will be this year. It will be released. So I would say there's certainly been significant interest from Truro in Sydney, Bridgewater. They're the first three that kind of come to mind. I know that the folks with Justice, there's a working group too with our office, kind of working together on this, kind of working with police service, also with folks in the healthcare system. And we'll also need to work with identified CBOs within the community, especially if it's a non-police kind of response model. So this will be new for some of them, right? So we'll probably have to kind of work together to educate them and kind of to give them the best available information to effectively make this, successful. But I would say it's probably one of the more consistent, I would say, gaps that I've heard kind of, being across the province. So we'll certainly try to get this rolled out as efficiently and as quickly as possible. Yeah.
I recognize the Honourable Member for Halifax Citadel Sable Island.
So with the framework being available this year, do you anticipate any municipalities actually rolling out an alternative service in the coming fiscal year?
I recognize the Honourable Minister for Addictions and Mental Health.
So the RFP right now is posted for the framework. So I mean, I would want it done as quickly as possible, to be quite honest, but I know there has to also be kind of strategic kind of planning to successfully implement it. I would certainly say that there's been significant interest from Truro specifically, right from the beginning, with the police chief there and some folks within the business community. So I think it's important to note that there will be an opportunity to have access for first responders to triage mental health calls, whether that's through virtual or telephone kind of access. We've also kind of been looking at, I know in some jurisdictions, they've actually embedded kind of clinicians within the dispatch center as well. I've seen pretty good success with that. So the framework's posted now, and we'll certainly try to get that rolled out as quickly as we can. Yeah.
I recognize the Honourable Member for Halifax Citadel, Sable Island.
So I have to admit that I meant to go back and try and figure the answer to this question out myself, but I haven't, so I'm going to ask you. How many I'm going to ask the Minister, how many services or contracts does TELUS currently have to deliver different types of mental health services in Nova Scotia?
I recognize the Honourable Minister for Addictions and Mental Health.
So it'd be two. So it'd be the Access Wellness and the services for volunteer firefighters and ground search and rescue workers.
I recognize the Honourable Member for Halifax Citadel, Sable Island.
Were there RFPs issued for that, or they were sole source?
I recognize the Honourable Minister for Addictions and Mental Health.
So the Access Wellness was an RFP, so went through the procurement process, but the firefighters was a sole source.
I recognize the Member for Halifax Citadel, Sable Island.
So I talked about this letter in the House already in my budget response, but many of us, members of committees, yourself as a minister, received a letter dated February 20th, 2024 from, I think, all of the child and youth psychiatrists who work for the province. So I read through their names when we were in session, so I won't go back through that again. But you know, and I think, I mean, the tone of this letter is that they are very, very concerned about the impact of both the clinical psychological services pilot and Bill 334, the Health Services and Insurance Act, and that they feel that this will be devastating for the public system in which they work. So I'm wondering how the minister is responding to this letter.
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, certainly anytime we get feedback, especially from clinicians in the province, something certainly we take very seriously in the department. I mean, we've been very clear from the beginning that we remain dedicated to the implementation of universal access. Certainly take all those letters very seriously, read them myself for sure. As we continue, to make record investments in the mental health and addictions care system, primarily in the public part of the system for sure. So we'll certainly take those concerns into consideration. I think at the core of the issue of that specific letter is probably compensation in the public system. So I know those conversations with psychologists specifically will be at the collective bargaining table. So I think that'll be a fair process, as we've seen with doctors and nurses and paramedics. So I know the Minister of Labour Relations will certainly have those conversations. And we always take feedback from clinicians. I spend a lot of time myself talking to clinicians across the province. So something, I'm certainly aware of. And this isn't an either-or situation, right? So we certainly know that, we need a strong publicly funded system, and we might also need some additional resources for the non-urgent sort of issues with folks. So we'll certainly work towards implementation of this and continue to do everything that we can. Thank you.
I recognize the honourable member for Halifax Citadel, Sable Island.
And, I think I was concerned when I received this letter because, as you noted, the struggle to recruit and retain a full complement of health human resources in the sector is very difficult. And we know that these folks are, really overstretched, and people have to wait a long time to get to see them. I take very seriously when, when the whole team comes forward and says we have a problem and we're very concerned and things need to change now. So perhaps you can report back to the House in terms of how those discussions go, particularly with these psychiatrists, and how you can stabilize that section of the workforce and their concerns.
I recognize the honourable member for Halifax Citadel, Sable Island.
So you have talked about the autism pilot, so the $500,000 invested to reduce assessment wait lists for childhood autism spectrum disorder and attention deficit hyperactivity disorder. But we've already heard from several practitioners, the psychiatrists amongst them, but others as well, that the pilot is actually just going to exacerbate the chronic issue of failure to retain and recruit mental health clinicians, and concerns around practitioner uptake in general. So I'm wondering if you can speak to how many practitioners you were hoping to engage with this, or what your goals were in terms of assessments, and whether folks stepped forward from the private sector or the public sector to undertake this work.
I recognize the Honourable Minister of Addictions and Mental Health.
Yeah, so I think early estimates from the department estimated somewhere in the range of 5 to 10. So we actually have 8. So those 8 are from the private sector. So I think when you add the autism diagnostic plus the ADHD diagnostics, you're somewhere around 56 tests, right? That wouldn't have been performed if it wasn't for the pilot. So I would like to see that number higher. But given that it's a new program in the province, I do think that's important for those 56 families, right? They got that diagnostic assessment. And it's a pilot, right? We will continue to learn, certainly collect data, talk to the clinicians, talk to the families. And that's I think the important thing about a pilot, that we're really trying to learn, right, as we kind of increase these things.
I recognize the member for Halifax Citadel, Sable Island.
And can you remind me how many people are on the wait list, or how many children/families are on the wait list for autism and for ADHD assessments?
I recognize the Honourable Minister of Addictions and Mental Health.
I know for autism it's around 1,600. ADHD is a little bit more complex, so I can see if we can get you a number for that, though, and follow up. Yeah.
I recognize the member for Halifax Citadel, Sable Island.
So, I mean, that's still a long way to go in terms of getting 35 assessments done out of a wait list of 1,600 that I assume renews itself quite frequently. And, one of the things, so having a child myself who has autism, one of really the hugest challenges that we faced was the drop-off of sort of services and assessments sort of after the preschool age. So, yes, they're supposed to get support within the public education system. And no, we never actually saw any of the autism specialists at any of our IPP meetings, at any of our in-school meetings, and there were plenty. So my concern is what happens. So you have this diagnosis, and then hopefully you get access to some of the early childhood services that are important, but the need doesn't stop at age 6, and I know you know this. So for the 35 families who had this assessment, what happened next? What services were people given access to, and were they free, or were they being referred to services that had an associated cost?
I recognize the Honourable Minister of Addictions and Mental Health.
Yeah, so I wouldn't have that level of specificity of information based on when those assessments have taken place. I would say, as you know, we kind of enhanced the preschool autism strategy across the province. There's certainly programs like Quick Start, and there's educational programs for parents and families that historically were just in the HRM, so that's province-wide now. They've been staffing up significantly. I know there was a pilot in Northern Zone, I believe, with mobile teams with various kind of healthcare disciplines to kind of go to crisis at the homes with families. That was kind of led by folks within the Nova Scotia Health. So I don't have that level of specificity, but there is a much broader spectrum of services, I would say, available to families in the province.
I recognize the Honourable Member for Halifax Citadel Sable Island.
So one thing that Autism Nova Scotia has been a vocal advocate for, I'm sure this is no surprise, is a provincial autism strategy. And particularly, they had a lot of concerns about the Canadian autism strategy being released, and that there would be funding under that. And if we're not lined up, we're not going to be able to access that funding, and without a strategy, so we won't be able to meet the federal government requirements. Will you be developing a provincial autism strategy?
I recognize the Honourable Minister of Addictions and Mental Health.
Yeah, certainly a very important issue. Certainly the team, I would say, works very closely with Cynthia and her team. She's probably one of the leaders, I would say, in Canada in terms of advocacy and knowledge with autism. So I would say conversations are certainly very active right now, also with the Minister of Education and Early Childhood Development. So I certainly something I support, and I think we're very close. Yeah.
I recognize the Honourable Member for Halifax Citadel Sable Island.
That's great. And, Autism Acceptance Month is coming up. What a great time that would be to announce the commitment to a new strategy. I mean, it's all lining up, Minister. You can just take advantage of that. I think April 2nd, we're raising the flag here at the House. So, it's all there. So I can't wait for that announcement. And so as you're working towards this integrated model, and I can absolutely appreciate the complexity of that. How are you bringing together information systems? So will all mental health services and wait lists, will you be in the One Patient, One Record initiative? Will mental health, not you, will mental health be in the One Patient, One Record initiative?
I recognize the Honourable Minister of Addictions and Mental Health.
Yeah, certainly I would say the mental health and addictions system, and especially if you look at the hospital inpatient system and outpatient system, we're unique in the sense that the addictions and mental health program was the first provincial bed management system, I guess you would say, for lack. So you could see how many beds on what units and which hospitals and these sorts of things, right? So I have had conversations with folks that will be kind of leading the One Patient, One Record. That's going to take some time, right? It's a significant infrastructure change from some of the antiquated technology that's in the hospitals. So I think we'll certainly be part of that process. In terms of integration with central intake, in terms of, expansion of hours and the opportunities that could be potentially coming forward with digital healthcare too, right? And so there's I think some exciting innovations and opportunities, but we'll certainly have to have a single point of access. I think is certainly a goal of mine. We're not there yet, but we're certainly, everything we're doing is working towards that vision.
I recognize the honourable member for Halifax Citadel Sable Island.
Yeah, and I do think it's essential, and it's even overcoming, I think, part of the stigma around mental health as well. So, within the IWK system, for instance, kids have a physical health file and a mental health file, which of course is not helpful when you want to treat the whole child, but also just it's like this, it certainly seemed very stigmatizing to me, and then also the added burden for folks to try and keep track of all of their various interactions with services and that sort of thing. So certainly it will be amazing when we have that. Just back to community-based organizations. So the 6.7 million will be multi-year agreement. Will that all be multi-year agreements with community-based organizations?
I recognize the Honourable Minister for Addictions and Mental Health.
So yeah, there'll be three specific streams, kind of through the community wellness framework. So the projects stream specifically, that'll be working with the Mental Health Foundation of Nova Scotia. So that'll be $1.75 million every year. So just be kind of core funding to them. The delivery partner stream would be more so, I guess, what you'd say operational kind of funding. So this would be 3 year agreements with kind of accountability frameworks put in place. So these could be long-term sort of programs. I mean, there's some great youth groups across the province that I can think of. So, and then that'll be 4.636 million. So that bucket. And the last one will be a $300,000, which is something new that we're trying, is a research and innovation stream. So this will be for research projects, sort of research partners in the province, just to really collect data, especially around community access to treatment and these sorts of things. Yeah.
I recognize the Honourable Member for Halifax Citadel Sable Island.
And so just to clarify, the Research Innovation Fund, will that be open to community-based organizations to propose their own research, or will they require, like an academic partner to access that?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I know it'll be a very formal application, but my thought process, that's probably to be determined right now. But I would certainly, couldn't see why community-based organizations couldn't benefit from this. Yeah, thank you.
I recognize the Honourable Member for Halifax Citadel Sable Island.
And when do you plan to launch that funding?
I recognize the Honourable Minister for Addictions and Mental Health.
Hopefully in the spring, as soon as we pass the budget.
I recognize the Honourable Member for Halifax Citadel Sable Island.
And then, so the operational funding that will go into these 3-year agreements. So, I mean, basically my question is, are you starting a whole bunch of, like, all of those projects will be starting new? I mean, they might have kind of existed before or that sort of thing, but like, basically, you're planning to get 4.36 million signed in agreements with community-based organizations this year. That's my question. Is the minister planning to?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so we've provided a number of one-time grant fundings to a variety of groups across the province. So that was 6.9 million so far this year. So the community wellness framework will be an additional 6.7. So, we have identified groups right across the province for sure that, I think would be strongly benefit from the core funding for sure. And I believe the expectation is in coming years that this number will increase based on demand and sort of outcomes based on our evaluations.
I recognize the honourable member for Halifax Citadel Sable Island.
And I think you sort of referred to my next question, which is, one of the challenges, but also opportunities when you go out with, a call for proposals or call for projects, is making sure that, you have regional diversity and regional coverage, and, you have coverage from various ages, and, all this. So how are you going to ensure that all Nova Scotians have access to these community-based services?
I recognize the Honourable Minister for Addictions and Mental Health.
So yeah, there is health and equity consideration built in the evaluation frameworks of the proposals themselves. So certainly that will ensure geographical and equitable distribution of funding.
I recognize the Honourable Member for Halifax Citadel Sable Island.
And maybe you could speak a little bit more about how the needs of equity-seeking groups, equity-deserving groups, to us LGBTQIA+, the African Nova Scotian community, rural communities, newcomers. How are you using that framework to ensure that you understand the challenges facing diverse communities and that they're being addressed through the programming of the department or the office?
I recognize the Honourable Minister of Addictions and Mental Health.
Yeah, so certainly in regards to equity, diversity, inclusion, accessibility of services, we know there's certainly been historical lack of access to services for equity-deserving communities in Nova Scotia and across the country. So we do have a lived experience advisory group as one example, who provides very valuable information and development of programs specifically relating to the community wellness framework. Certainly myself, I spend a lot of time traveling to meet with stakeholders myself in the province, which I think is very important to get their perspectives. And certainly some specific, funding initiatives in order to support this. The African Nova Scotia Clinical Services Pilot, I think would be a good example. Certainly I've met with Tejikamic and our First Nations chiefs and kind of healthcare directors many times myself. And they're certainly continuing to develop their First Nation strategy as well. So we're really just there to support them. And certainly there's been a lot of work done across the healthcare system with the healthcare equity framework as well. So that's just, I think, a couple of important examples to kind of guide things that way.
I recognize the Honourable Member for Halifax Citadel Sable Island.
And And within the 6.7 million budgeted for community-based organizations, is there any specific amount within that that is allocated towards working with African Nova Scotian communities or with First Nations, Inuit, or Métis communities?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, so I certainly think that will be part of the evaluation criteria once the calls for proposal goes out. I don't have that level of detail yet now because it's not passed in the budget at this point, but certainly will be an important consideration to support those groups.
I recognize the Honourable Member for Halifax, Citadel, Sable Island.
And I'm wondering also about support for the 2S LGBTQIA+ community. And, you know, certainly youth have often had lower mental health outcomes than straight and cis peers. And, you know, I think a lot of folks are really struggling, are really scared, are feeling very isolated, attacked online, attacked by, you know, leaders across the country. So I think making sure that programming can be offered that supports them is really important. Do you have anyone within the office who has, you know, sort of written in their job description the need to address issues facing the 2S LGBTQIA+ community?
I recognize the Honourable Minister for Addictions and Mental Health.
Yes, we do have someone that was a key part of the equity, diversity and inclusion in the community wellness framework who reached out directly to community groups as part of her job description.
I recognize the Honourable Member for Halifax, Citadel, Sable Island.
Is the office participating in the development of the 2S LGBTQIA+ action plan being led by the Office of Equity and Anti-Racism?
Just a reminder, there's 4 minutes left after. I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, I don't know specifically. We'd have to reach out to that staff member to touch base, and we can certainly follow up with the member.
I recognize the Honourable Member for Halifax, Citadel, Sable Island.
So there are currently 2 mental health day hospitals here and at the Cape Breton Regional Hospital site. Can you talk me through a little bit in the few minutes we have remaining, you know, the sort of uptake for the program? Are the beds always filled? And I guess also thinking about, like, do you see a corresponding, because I seem to remember from our earlier discussions about this, decrease in demand for inpatient beds?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, certainly in relation to the day hospital. So the Central Zones Day Hospital was launched in April of 2022. So 2,749 visits thus far, which saved an estimated 5,901 inpatient days in the hospital. The one in Cape Breton opened in July of 2023. So it's 471 visits so far, which saves 722 inpatient days. So certainly have a significant impact, not just in those zones, but in provincial inpatient bed capacity overall.
I recognize the honourable member for Halifax Citadel Sable Island.
I can't do the math quickly right now, but are you seeing the same impact in both HRM and CBRM, like in terms of the ratio between the two factors?
I recognize the honourable minister of Addictions and Mental Health.
Yeah, I would say it's probably a little bit too early to tell for Cape Breton because we haven't only opened since July. I would say, you know, it's not just about saving beds either. It's certainly better care for patients, right, that are getting care at these facilities. When we opened the one in Cape Breton, we had as part of the announcement, we had someone that used the service, like speaking from a first-hand perspective, which I think was much better than hearing me talk about it, right? So gave a very valuable perspective on his experience with him and his family. So certainly as we expand, you know, two more in the province, I do think it'll have an impact on inpatient bed capacity and patient experience for sure.
I recognize the honourable member for Halifax Citadel Sable Island.
And are you using any standardized measures for folks who access the day treatment program in terms of functionality or that sort of thing?
I recognize the honourable minister for Addictions and Mental Health.
Yeah, I know there's routine patient monitoring in terms of outcomes, but it's a bit more complex, right? 'Cause
Order. The time for the NDP caucus is now expired. It is time for the Liberal caucus. I recognize the honourable member for, Fairview Clayton Park.
Thank you, Madam Chair, and the Liberal caucus will cede their time to the independent member.
So I recognize the honourable member for Cumberland North.
Thank you, Madam Chair. Good evening, Minister. And I just have a few questions pertaining to addictions and mental health services in Cumberland North and in Cumberland County. And my colleague is listening here, so I'm sure he probably has all the answers, but we'll ask. One of the questions, Minister, was around detox services. So we have I believe, a growing issue with addictions in our area, in our community, in particular crystal meth and cocaine use reportedly are on the increase, and I'm hearing that from law enforcement mainly. And I'm also hearing that the detox for Cumberland County, which is located in Spring Hill, instead of being open 7 days a week, is only open 5 days a week, and patients are being discharged on Friday, whether they have a place to go to or not. And I'm hearing from some of those patients that they come to the MLA office and they don't know what to do or where to go. So I'm wondering if there's any plans to increase the detox to be back open to 7 days a week. And I guess in follow-up with that, in relation to that question, I'm also hearing from patients that have gone there that they feel that medical management isn't enough. So they're reporting that the detox is really just providing medical management. So for withdrawals, physical withdrawal of the whatever the drug may happen to be. And they're looking for other help, like for counseling, therapy, as well, sort of a more holistic approach. So I'm wondering if there is any plans to offer, as well as being open 7 days a week, offering more than just medical management for the detox.
I recognize the honourable minister for Addictions and Mental Health.
Yeah, certainly with All Saints specifically, the hospital there, the inpatient withdrawal services, some staffing impacts have caused some reduction in services there, something we're working very hard to reopen. I do think something that will have a positive impact in that area is in Amherst. So in the second quarter of 24-25, we're going to be opening a recovery support center in that region, so which is low barrier access to care for substance use, gambling, family, sort of advanced kind of programming for folks. So I think that's very positive. Most of the recovery support centers that we've opened so far do operate 7 days a week. Some are open Monday through Friday, depending on human resource constraints. So I do think that's positive. And I do know, speaking with clinical leadership kind of in that zone, they're certainly working on utilizing other spaces in that facility to increase addiction day programming, for example, and other sort of resources within the community.
I recognize the honourable member for Cumberland North.
Thank you, Minister. That's great news. Great to hear that. And I think you are likely, the minister rather, is likely already aware of this, but we have a real wait list for child and youth psychiatry. And I'm contacted, I think around by 10 parents from mid-November until January that were waiting for appointments with the child and youth psychiatrist, and they were very frustrated because waiting for these appointments was holding up treatment, but also holding up getting access to other support services through the education department. And in each situation, we did, the parents wanted to sign a consent and ask for help, and it did seem to expedite getting some appointments. But my concern is, Minister, that there's a lot of other parents that wouldn't know to contact their MLA to ask for help. And so I'm wondering if there's any plans to try to help improve access for our children, specifically our young children who are trying to get appointments for psychiatry.
I recognize the honourable minister for Addictions and Mental Health.
So yeah, I do think over the next couple of years, we will be rolling out the provincial integrated youth services models across the province, so 2 of which will be in Northern Zone. I don't have the locations with me here today. We're very close to that. Certainly in terms of adult psychiatry, I know we did just recruit 3 psychiatrists to that region, which I think is a great success. Certainly in terms of child and adolescent psychiatry specifically, I'd have to kind of touch base with the folks in that region to get probably some more specific information for you. I know in certain situations we have increased virtual care with child. If that's ideally we'd want someone there physically in the community, but there's certain situations where virtual care is appropriate. There's also been situations where child and adolescent psychiatrists will do like periodic visits to communities, whether it's a day or a week, a month, to see kind of patients in the community. So we can certainly talk to leadership within psychiatry for child and adolescent and follow up with the member if that works. Yeah.
I recognize the honourable member for Cumberland South.
North. What? Okay. Thank you, Madam Chair. And thank you to the minister. And I appreciate that. It's a real concern because we have a lot of children in our school system, in our elementary schools, that are, there's a real delay for them to getting treatment because of these delays. I do want to acknowledge and thank the minister and the department for a couple of things, and that is, back about 5 years ago, I was informed that Cumberland was not included on the Involuntary Psychiatric Treatment Act or guidelines, and we had asked, I had asked, and others had asked for that to be added, and it was added. And just in the last couple of months, the minister's probably aware that we have 2 new psychiatrists in our area, and not only are they taking patients off the wait list, they're also going to our emergency department at Cumberland Regional when needed. And I can't tell you how positive that is for families when they're going through a crisis. And it's been a long time coming, and I'm just want to let the minister know how much that is appreciated. And a couple of other questions before I finish off. I'm wondering if the minister can update us, the people of Cumberland, if there's any plans or any update on getting a mobile crisis unit for either Cumberland and/or the Northern Zone to be able to respond to mental health crises in the community.
I recognize the honourable minister for Addictions and Mental Health.
So yeah, there's an RFP posted now for a framework for mental health models for mobile crisis supports. So this will be a provincial framework, right? So, and this will be a collaboration between law enforcement, healthcare, probably some community-based organizations. So I know we've had significant conversations with a variety of stakeholders across the province. So if there's certainly interest within, the northern zone from law enforcement or from folks within the community, I would certainly encourage you to get them to contact the department. So this will be, the non-police, police with healthcare. This is the framework is kind of going to iron out all those details. But certainly there's been a $675,000 increase in this year's budget for that framework. So I know it's needed, especially in rural parts of the province for sure. So look forward to seeing what comes from that.
I recognize the honourable member for Cumberland North.
Thank you, Madam Chair. There's been expressed by many in the community a need for a mobile crisis unit in Cumberland and in the northern region. And unfortunately, we've had many situations where family members will contact us where there may be somebody living in their home and there's a clear mental illness, but they refuse to go to the hospital, they refuse to go for help, and the family just don't know what to do. And law enforcement have said, we can go and do a wellness check and ask them if they're planning to harm themselves, and if they say no, then the police will say, yes, this person is mentally ill, but they're not posing a threat to themselves or to anyone else, so there's nothing we can do. And there's many times where families feel very helpless, so there's real gaps in the system. And then just leading to that are the gaps in the mental health system for people that are struggling with a severe mental illness, that are living on the streets and that are living unsheltered. And many people in the community don't know how to help them. And I just want to mention that is certainly a concern in our area too, and just try to find ways to provide some mental health services to those individuals. And I know every individual is unique, and that's how they have to be approached as well. But they're not receiving, when they do go to the emergency department, they're not receiving the care that they need in most circumstances. And our emergency departments are saying they're not properly set up to handle these kinds of situations. So we definitely need more support. So I know our local manager has said he's requested a mobile crisis unit. And then the last question I'll ask the minister is are there any plans for expansion of rehab facilities here in the province, in the northern zone, to help people that are struggling with addictions that may need more than just the regular detox withdrawal management that we currently have available? And for example, in neighboring New Brunswick, we have a new rehab facility that's open. It's called Ocean View, and they're going through the certification process. They're not quite there yet, but they're doing some amazing work in bringing people that are really struggling, living on the streets with addictions, and they're bringing them in and helping them to try and get clean, but they're really looking for funding. And I'm wondering if are there any plans, given the growth of addictions that we're seeing, is there any plans for improving rehab services for the northern zone?
I recognize the Honourable Minister for Addictions and Mental Health.
Yeah, certainly we have, I would say, robust treatment service, outpatient-based services for substance use in the province. I think there's 23 outpatient-based clinics across the province. Certainly what's been happening with the housing crisis and, very complex, persistent kind of folks that are having very challenging issues. I would say it certainly, has come to the forefront, not just for this department, but for a variety of departments across government. So we certainly have had conversations with the federal minister and a variety of the provincial and territorial ministers as well. They're certainly having similar issues. So we are kind of having those ongoing conversations, certainly looking at what best models of care work and from a human resource capacity what we can do. So nothing specific to report tonight right now, but I would say those conversations are active for sure within the department.
I recognize the honorable member for Cumberland North.
Thank you, Madam Chair. That concludes my questions.
Thank you. Are there any other questions from the Liberal or the NDP caucus? No. Is there any questions from the Progressive Conservative caucus? No. Oh. Yeah, okay. All right, so now I will recognize the Minister of Addictions and Mental Health for his closing remarks. Honorable Minister of Addictions and Mental Health.
Thank you, Madam Chair. Thank you, everyone, for the thoughtful questions. So I'm just going to read my resolution now. Yes.
For both, please. For both E28 and E17.
So I'll do E17 first. Is that okay? Yeah. Resolve that a sum not exceeding $6.96 million be granted to the Lieutenant Governor to defray expenses in respect of Communications Nova Scotia pursuant to the estimate.
Will you please read the other one as well?
E28, resolve that a sum not exceeding $359,619,000 be granted to the Lieutenant Governor to defray expenses in respect of the Office of Addictions and Mental Health pursuant to the estimate.
Shall the resolution stand? The resolutions are stood. I thank you, Minister, Honourable Minister, for your time, and we shall have a short 5-minute recess. Order, please. The Subcommittee on Supply will come to order. It is now 9:04. The Subcommittee is meeting to consider estimates for the Department of Economic Development as outlined in Resolution E6. Resolved that a sum not exceeding $96,782,000 be granted to the Lieutenant Governor to defray expenses in respect of the Department of Economic Development pursuant to estimates. I will now invite the Minister of Economic Developments to make opening comments up to an hour, and if they wish to introduce their staff to the committee, please do. I recognize the Honourable Minister for Economic Development.
Thank you, Madam Chair, and thank you for the opportunity to share some comments on the work of the Department of Economic Development. I would like to begin by introducing a couple of people who were able to join me on somewhat short notice this evening. I have with me my Deputy Minister, Scott Farmer, to my right, and to my left, Peter McCaskill, who is CEO of Invest Nova Scotia. Madam Chair, I'd like to start by touching on our government's priorities for budget 2024-25 and how the Department of Economic Development fits into that larger vision. Our new budget builds on the work of our government to date. It invests more in healthcare, in building a strong workforce, in housing, supporting Nova Scotians and communities, and in a stronger, cleaner economy. With this budget, we are positioning our province for sustainable growth and greater prosperity for all Nova Scotians. The Department of Economic Development has an important role in this, and we are steadfast in our focus. Madam Chair, the Department of Economic Development is a small team comprised of just 28 people. However, as I say to companies looking to invest or locate here, in Nova Scotia, small is our superpower. Our relatively small size is what allows this province to be nimble, to react quickly to opportunities or challenges, to connect investors and entrepreneurs to the resources they need, to assemble key decision makers in a room when a project spans departments or levels of government. This, I am assured, doesn't just happen in every jurisdiction. Similarly, this team of talented, thoughtful, passionate, and above all, dedicated people have shown themselves ever ready to respond to a need, to face a challenge, or seize an opportunity. An example that came to mind as I prepared these thoughts relates to last spring's terrible wildfires and the support stood up to assist businesses. Now, lest anyone be thinking that's something the department has certainly done before, which it has. So what's the big deal? Well, the deal is the key person who had set up business support programs through all the various phases of the pandemic, as well as after Hurricane Fiona, our internal expert in this area, his home was among the first destroyed when fire broke out in Tantallon. 2 others from that small team were among those evacuated, left unsure whether their homes were damaged or destroyed. Nonetheless, our remaining team rallied and, working collaboratively, got the Small Business Wildlife Relief Program up and running by June 5th, providing a one-time payment of $2,500 to 668 businesses in Halifax and Shelburne counties. And they did this while still advancing other files and priorities without missing a step or dropping a proverbial plate. I raise this now early on in my comments as I think it's deserved and important. We live in a world where it's become so easy to complain or criticize, to make people, particularly those in roles within the public service, faceless, or worse, we turn them into caricatures. And I want to challenge that. And so I am sharing my experience and my privilege in overseeing a department where, thanks to its size, I get to know these people as individuals, to see the high level at which they operate, and work with them to grow the economy and the opportunities for all Nova Scotians. Thank you to them all. Additionally, as minister, I have the privilege of working with a number of partner agencies and organizations. Chief among them are Crown Corporation's Invest Nova Scotia and Events East. The Events East team focuses on delivering unforgettable events that drive economic growth and showcase our vibrant province in all its glory, highlighting local in their menus, tucking it in their swag bags, and of course, featuring it on the convention center stages. Madam Chair, over the past couple of years, I have attended many events at the convention center, and every single time I arrive and I've watched to confirm that this takes place across the board, I am warmly welcomed and immediately offered assistance by convention center staff. Now, in my case, it's usually a matter of directing me to what floor I need to be on for the event for which I am running late. But for those attending national and international events here, it can range from directions to the nearest pharmacy, a good place to have dinner, or day trip recommendations for the weekend ahead. Meanwhile, Invest Nova Scotia is our province's flagship agency for business development, offering programs and services to support businesses at every stage of their development. From the funding and fostering of innovative startups to helping a promising company get to the next level. Supports to assist established firms to de-risk investment in new processes or technology, as well as investment attraction. Again, a group of very dedicated and effective people. Madam Chair, the Department of Economic Development's work is focused on 4 broad planks: growing strategic sectors, increasing productivity, investing in entrepreneurship, and ensuring all communities experience growth and prosperity. To achieve these aims, it's essential that we are engaged with the business community in the fullest sense and communicating openly and honestly. And as minister, along with my deputy, our EDs, program officers, our investment attraction executives at Invest, our CEO, their sector experts, and regional business advisors, we are out there talking and meeting with individual businesses, with sector associations, with post-secondary institutions, downtown business commissions, regional enterprise networks. It's these folks who know the ground game, be that the state of a particular industry or the economy of Southwest Nova. And it's working with them that we make progress. And together, we are making great progress. This is an incredible time in the history of our province. We have the momentum of growth and the opportunities that flow from it. We are challenged to make the most of this moment, to use it to create the future we want and to keep that movement going, which is why we have a suite of programs that focus on innovative, sustainable, and green businesses. Invest Nova Scotia's acceleration programs for startups are a great example. These programs are helping Nova Scotia startups in areas like agriculture, clean tech, health tech, oceans, and ICT get ready for investment. Excuse me. Madam Chair, they're helping entrepreneurs like Rashmi Prakash of Aruna Revolution Health to get innovative, sustainable green products to market. Madam Chair, I first met Rashmi while attending a pitch competition at the Emira Idea Hub. She approached me showing such incredible energy and explained how she had moved to Nova Scotia less than a year before to launch her company here because of the supportive ecosystem. Aruna produces locally made, biodegradable, and fully compostable menstrual pads, which they make in a production facility in Burnside. Rashmi has been successful in 2 of Invest Nova Scotia's programs, Green Shoots and Accelerate, which has allowed the company to improve its technical processes, scale the business, and ultimately attract investors. It is just one of the early success stories to be found here. Madam Chair, I'd like to take a few minutes to touch on some of our focus areas over the past year. An important part of our work is ensuring we are responsive to the current needs of businesses, entrepreneurs, and communities across the province. The Department and Invest Nova Scotia administer 33 programs for businesses in addition to other supports such as business training. We are always looking for new ideas to improve or add to our programs and help us achieve our economic goals faster. That's why we conducted a fulsome review of the mechanisms we use to attract investment and assist businesses in our province, and are currently integrating that feedback into our programs. Madam Chair, over the past year, a tremendous amount of work has taken place under the banner of Nova Scotia Loyal. As Minister, I am confident this program will deliver on its goals to instill pride, inspire and invigorate our growers, harvesters, manufacturers, and consumers, and support a shift in demand and consumption of Nova Scotia products. In fact, initiatives over the past year to test and try consumer reward mechanisms, because we need to know what works most effectively, have already resulted in new customers and increased sales for hundreds of Nova Scotia small businesses. In the pre-Christmas period, for instance, we had our brand ambassadors at 10 different events in communities including Wolfville, Sydney, New Glasgow, Lunenburg, and Halifax, talking about the program and distributing $5 Nova Scotia Loyal vouchers, which they could redeem like cash against purchases with participating vendors. Over the course of this period, we engaged with 32,000 Nova Scotians, providing $126,000 in vouchers that were redeemed with nearly 600 unique Nova Scotia businesses and resulted in over $534,000 in local spending. Now, Madam Speaker, I'm not going to sit here and suggest that that was a pure 400% lift. There are a few too many parameters in the equation to make that kind of a conclusion. It was, after all, the holiday shopping season, and people were reasonably at these events to pick up gifts. However, anecdotally, many of our participating vendors told us their sales were up at these events, and they credited the program for giving them added profile via Loyal. Indigenous maker and business owner Melanie Sampson of Hi Love Greetings in Kings County posted to her Instagram saying, "I participated in the $5 voucher program by Nova Scotia Loyal at 2 markets, and that incentive for shoppers really helped my little business. I can't wait to keep making fun goods from this paper I'm now fully in love with." And that paper, for the information of those listening, is plantable seed paper that she crafts into beautiful cards, bookmarks, and other favors. Another pilot with a more verifiable impact was our school program, wherein we provided vouchers to 13,000 children across 4 school districts. A very encouraging percentage of these vouchers were redeemed at farmers markets. My recollection is 67%, and if I'd had a little more time tonight, I might have been able to double check that, but it was very high. And I don't know about others in this room, but when my children were young, it was questionable whether any note, report card, or test to be signed would even make it to me. I tended to find these things at the bottom of book bags at the end of the school year. So the fact that they made them home, those coupons made it home, and were then redeemed was a win, no matter how you slice it. The fact that many families also reported it was their first time visiting a farmer's market was an added win. We've also been working closely with our business partners, for instance, our growers. Many of them confirmed that there is demand for more of their products. Retailers, large and small, have recognized the power of the local food movement. They see the advantages of shorter supply chains and fresh from the field produce. But for producers, a common challenge is getting their products to the market, particularly when time away from the farm impacts productivity. That's why we recently launched a pilot program with Food and Beverage Atlantic to research and test consolidated distribution models for local produce, so we can help get more local on the shelves. And Madam Chair, we are working across government, in particular with our colleagues at Service Nova Scotia, to ensure our government is not asking of Nova Scotians what we aren't doing enough of ourselves. I speak here of initiatives to help connect Nova Scotia companies with government procurement opportunities. So to my colleagues in opposition, who continue to ask, as is their right and indeed their role, where is Nova Scotia Loyal? I tell you, it's all around you. But specifically, that in 2024-2025, you will see us finalize the program eligibility criteria, implement the final brand design and marketing strategy, launch the Consumer Rewards Program, and develop procurement interventions. Madam Chair, Nova Scotia is growing as more and more people realize our potential and the opportunities to live, work, and invest in one of the world's finest places. We recently announced a new payroll agreement with global technology service company Cognizant that we expect to deliver an additional 1,000 high-paying jobs in Nova Scotia within 6 years. That's on top of the 1,000 employees Cognizant has already hired in its first 2 years in this province. Madam Chair, Cognizant has been a success story in one of our strategic growth centers, creating well-paying jobs for Nova Scotians, for new post-secondary graduates, and for newcomers. Madam Chair, our government is looking for ways to better support Nova Scotia's strategic sectors, like the IT and life sciences sectors. Those high-wage, high-productivity sectors with strong potential to grow and thrive. Targeting these sectors allows us to create jobs, increase the productivity of existing businesses, and be more competitive. We will continue to meet with startups, businesses, researchers, and sector leaders to help inform what is required to grow these industries and sectors. But a good example is the life sciences sector, which has very high growth potential for Nova Scotia. First of all, we've got an especially strong set of assets, including a strong local community of life science companies and a crackerjack industry association in the newly formed Life Sciences of Nova Scotia. A post-secondary environment with a strong reputation in this field to both elevate research and produce the talent that this industry so desperately wants and needs. But here's the other piece. As a government committed to transforming healthcare, we've gone to this industry and said, how can we work together to grow your business while also providing Nova Scotians with access to the most cutting-edge, latest therapies, drugs, and interventions that medical science can offer? It was in that spirit that Nova Scotia sent its largest ever delegation to the world's largest life sciences conference, Biotech, in Boston last June. The delegation included the Honorable Michelle Thompson, Minister of Health and Wellness, myself, and had it not been for the wildfires, it would have included our Premier. We presented a joint, strong, compelling case to companies, and we invited them to follow up by coming here in September for an event called BioPort. Several firms took us up on that offer, and those for whom the dates didn't work followed up and connected in other ways. We have seen those companies, in some cases, already establish offices and programs here, and we most recently saw announcements about the Lighthouse Project, which will be working on the issue of childhood obesity here. All of this resulted from that very strong presentation at Boston. Madam Chair, our government is also focused on ensuring we are encouraging and supporting environmental sustainability. Our department will continue to focus on innovation, sustainability, and growing opportunities in key sectors, including clean technology and oceans. The world is realizing Nova Scotia's potential in the blue economy, and COVE is helping us leverage this potential to drive our world-class ocean tech sector. COVE is focused on collaboration, problem-solving, and sustainable growth. And it's this important work that is helping to propel Canada's ocean economy. We were very pleased when last fall, in a proposition that was greatly strengthened by the work of COVE, that Nova Scotia, specifically Halifax, has been chosen as the site for Canada's contribution to Diana, which is a defense innovation accelerator as part of our commitment to NATO. While details on what that will look like, we certainly know that it will only strengthen Nova Scotia's position in this industry. I'm focused on attracting and growing innovative, sustainable, and green businesses across our province. Businesses already here, businesses looking to relocate here, and the startups of tomorrow. Nova Scotia has many comparative advantages to leverage, including a highly skilled workforce, 10 universities, and our strong community college network, quality of life, an innovation ecosystem, and commitments to the environment and sustainability. These advantages enable us to attract new companies, additional skilled workers, and more people to our province. And people drive economies. Our investments in innovation are about building a stronger, more diverse and sustainable economy for Nova Scotia's future. It's why Invest Nova Scotia's early stage commercialization fund has a stream for low carbon technologies. The latest call for proposals closed in February, and those selected projects will be announced soon. Another 27 projects are expected to be completed under the Innovation Rebate Program. This is a favorite program of mine, without question. The majority of outcomes, the majority projects have sustainability outcomes, and the bulk of the projects take place in our rural communities. IRP supports companies like Lewis Moldings and Wood Specialties Limited of Weymouth to drive productivity, increase capacity, and adopt cleaner, more sustainable approaches. With the help of the program, Lewis Moldings installed a new high-tech production line to automate the filling and repairing of wood defects and increase production speeds. They also purchased a new boiler that uses fiber fuel, eliminating their use of propane to dry and finish their products. Madam Chair, we invest in organizations that provide programming, mentorship, and other services for entrepreneurs. Over the last year, we have signed multi-year funding agreements with Volta, with Ignite Lab, Propel ICT, Futurepreneur, Creative Destruction Lab Atlantic, and the Amera Idea Hub. This long-term funding reinforces our shared priorities in supporting founders and their teams in creating jobs and strengthening the economic landscape of our province. One of these innovators, Dr. Karen Cross, she is actually innovator in residence at the Nova Scotia Health Innovation Hub, is the CEO and co-founder of Mimosa Diagnostics Incorporated, a health technology company aimed at revolutionizing skin imaging and wound care. I had the pleasure of meeting Dr. Cross at Volta's grand opening in its new space in the former convention center in the fall. And she shared her perspective as a startup founder on the importance of the Volta Startup Hub. And I quote, "I relocated to Halifax from Toronto in 2021. Since then, I have been welcomed into the thriving innovation ecosystem here in Nova Scotia. Being part of Volta not only provided us with access to experienced advisors, but also surrounded us with a community of like-minded individuals striving for success. It's been a valuable part of our startup journey. Madam Chair, we are bringing more people and more businesses to Nova Scotia, building a globally competitive, skilled workforce in a world where talent is the number one need and often the number one challenge raised by businesses of all shapes, sizes, and sectors. And we're creating new jobs with higher wages. The technology sector is rapidly growing in our province, with many graduates, new Nova Scotians, and seasoned experts advancing their careers here. Our economy is gaining momentum. A prosperous and sustainable economy allows us to pay for things like critical infrastructure, like housing, like healthcare and education. Madam Chair, growing our skilled workforce, our population and economy is making a difference on Nova Scotia's finances. The investments my department is making are part of government's plan for a sustainable, prosperous economic future for Nova Scotia. Our government is targeting high productivity, innovative sectors such as information technology and increasing their percentage within our economy. We have a clear vision for the future of our province and, importantly, a shared vision. And together, we will build an economy that all Nova Scotians can benefit from. And with that, I'm happy to take questions.
Thank you, Minister. According to the practice that has been developed in this legislature, the opposition caucuses take turns asking questions for approximately 1 hour each. During a caucus's turn, the members within a caucus may take turns examining the minister on the estimate resolution. Only the minister may answer questions. Caucuses are also expected to share time fairly with the independent member. To begin the examination, I now recognize the official opposition. I recognize the honourable member for North Side Westmount.
Thank you, Madam Chair, and thank you, Minister, for your remarks. Well thought out and well written and well delivered. So congratulations and thank you to the staff for being here at this hour to help the Minister with her questions, and thank you to my colleagues across the floor for being here, and also the NDP. We're going to start out kind of slow and work our way into things. So I'm going to throw a little question out here. So we all know that we're in a crisis when it comes to affordability in Nova Scotia. So what is your department doing to make life more affordable this year for Nova Scotians?
I recognize the Honourable Minister for Economic Development.
Thank you, Chair. Thank you to the member for the question. We are living through an extraordinary time with historic inflation. Any Nova Scotian heading to the grocery store cannot help but notice that the size of the basket for the money spent is much smaller. And we know that while this is a pinch on the pockets of many Nova Scotians, it is much more serious for many. What I would see as one of our primary roles within economic development in terms of this affordability crisis, as you have named it, is to help our businesses. We know that high inflation is a fact in Nova Scotia, but as well in Canada and globally. Programs and supports, however, that can help our businesses to become more competitive and therefore and more efficient does have the impact, a twofold impact of hopefully keeping pricing as reasonable as possible, and equally providing for well-paying jobs within those particular companies and industries. So even though it does seem counterintuitive to think of those businesses who would take the leap and invest in their companies at a time when commodity prices are increasing, when there are supply constraints and demands on all inputs, including the impacts of the carbon pricing. Historically, we will see that time and time again that the companies who take decisive steps in a time of rising inflation and other difficult market headwinds, they are more successful and end up with higher returns and finding new markets for growth. So this is one of the areas where the Innovation Rebate Program is so key. And it really is a very, very popular program. So again, in spite of all of these headwinds, we have businesses rapidly maxing out budgeted allotments who are seeing the value of investing in better processes, new technology, processes that reduce their waste streams, increase their capacity, and make them more competitive, both for a consumer at home and for markets abroad. Now, realizing that not all businesses can make the size of investments that are permitted under IRP, which is a $350,000 investment up to $15 million, we have other programs to help small and medium-sized businesses to access expertise, to look at these same issues of efficiencies and higher productivity. The Productivity and Innovation Voucher Program is another one of those programs. So we see this as a key area where we can assist in addressing the affordability issues, but from through a lens of business development.
I recognize the honourable member for Northside Westmount.
Thank you, Mr. Chair. You threw me off there. Thank you, Minister. But specifically, you mentioned things that you can do for businesses to help them scale, and but what specifically can your department do for the people of Nova Scotia, the consumers, to help them or help businesses transfer some of those savings onto consumers so that they are feeling less of the pinch, as you called it, of the affordability crisis. So what specifically, or what programs specifically can your department put in place to make life more affordable for average, everyday Nova Scotians?
I recognize the Honourable Minister of Economic Development.
What I would say is that there are a number of departments across government that are doing important work in this area. The greatest area where economic development can assist is growing the economy, and with it, the incomes of Nova Scotians to deal with these pressures. Now, we know these pressures are real, and we know that particularly in the small business community, where we saw in 2022, for instance, we saw a lot of pent-up demand. And in industries like tourism and hospitality in particular, we saw an extraordinary year in 2022 that was not replicated in 2023. 2023 had certainly other unique challenges with a number, with the fires and weather events, and in a world where people are less inclined to book early. Those kinds of factors can quickly change plans. But also we had seen that surge. We had seen all the people who, or many people who had said, I haven't been able to go anywhere since pre the pandemic, and they were out there. So in 2023, with the increased costs of inputs, the increased costs of energy, the carbon tax, we have certainly seen that many small businesses are still in recovery mode. We continue to work with them. We continue to have mechanisms such as the small business loan guarantee, which offers loans to small businesses. But we do continue to assist businesses as best they can in growing and increasing their productivity, in growing their fortunes to become more competitive, and through the tax revenues that are generated through growth in our economy in that way to support Nova Scotians.
The Honourable Member for Northside Westmount.
Thank you, Mr. Chair. So, Minister, one of the things that you indicated that would be good for your department to do is to help to grow the economy and to help improve consumer spending and those types of things, and the small business loan for business, et cetera. But the opposition has indicated that we would put a 2-point cut on the HST. I'd like your opinion as to how you think that would work in helping to grow our economy. A 2% cut in the HST, would that be good for the economy?
The Honourable Minister of Economic Development.
Thank you, Mr. Chair. I have actually given quite a lot of thought to the opposition's position of reducing the HST as a mechanism that would certainly have an immediate, the price of a cost of a good, 13% tax versus 15. As a member of Treasury Board, in addition to my ministerial responsibilities, I am very familiar with the give and take of any of these decisions. And we have made a significant decision in indexing tax brackets as one way to ensure that more money stays in the pockets of Nova Scotians, that stays in their paycheck. And in just a few years, that is going to amount to $150 to $160 million able to circulate within the economy. So it is a question of the levers that are available and the choices that that a government may make. We have chosen indexing of tax brackets and some of our tax rebate programs. But I do hearken back, and this is why I have been thinking of this proposal. I think back to the years of the Dexter government and the Minister of Finance of that time, Graham Steele. And I was still a newspaper reporter in those days. And the finance minister did a tour of Nova Scotia. And his primary objective, of course, chambers of commerce and business organizations, community organizations, are usually very welcome to host the provincial finance minister. So there was no shortage of opportunities for the Honourable Mr. Steele to speak. And one of his stops was in Lunenburg. And he spoke, I still remember it because it was a very effective speech he gave that day, or talk he gave that day, and a very effective tour, because at that point we had a 13% tax. And he spoke to his audiences, as I say, that day in Lunenburg, primarily business audience. And he said, if it came to being unable to sustain services or to raising the harmonized tax to 15%, what would you pick? He kind of made it a this or that. And I watched, as a member of the media, I watched a business audience, and certainly no one likes the idea of additional taxes, least of all, as a tendency, business audiences. And the answer was, well, they'd take the 2% up to 15%. And by the time that minister had completed his tour of Nova Scotia, he had created a consensus that led to the 15% tax rate that has been with us ever since. So I do think back to that. It was a very effective analogy for that particular politician at that time, but I think that the rationale still holds, that we must look at what we might have to cut or be unable to proceed with when we make an adjustment to a major source of government revenue.
I recognize the honourable member for North Side Westmount.
Thank you, Madam Chair. And 2013 versus 2024, two completely different times, two completely different eras, two completely different economies, two completely different governments, two completely different, you get where I'm going with that. So right now we have a government that's swimming in cash, an extra $1 billion in tax revenue this year. There would be nothing to cut. We believe you have the money to do that, looking at the last couple of budgets, projected deficits followed up with some nice surpluses instead. So let's be clear. I don't think you'd have to cut anything. What do you think a 2% cut in the HST, giving Nova Scotia the lowest sales tax in the Atlantic provinces, would do for tourism, would do for small businesses, would do for just the economy at large? So being the lowest sales tax within the Atlantic region, do you think that would give us an advantage?
I recognize the Honourable Minister for Economic Development.
Thank you, Madam Chair. I guess I'd like to begin by agreeing. Will that be a sign of the apocalypse if we agree in this place? Agreeing that 2013 was a different era. Absolutely. Nova Scotia was still deep in the challenge of oat migration, among other things. And you are right that we are growing now, and we have seen benefits of that growth. Are we swimming in cash? Having spent many, many hours, particularly since the start of this calendar year, in Treasury Board meetings, making decisions among priorities, I have yet to see a single thing come to the Treasury Board table that didn't have good in it. And yet there are many, many things that we are not able to proceed with. There were things, very frankly, that I might have liked to undertake under the banner of economic development this year. Good ideas that I have had to park. Because again, we have to look at, yes, we've been fortunate to have ended our first 2 fiscal years in government with surpluses when we were anticipating and had warned the public or I should say signaled very clearly during the campaign, the election campaign, to the public that we were willing and believed we would have to run deficits, particularly to deal with the investments needed to stabilize and transform healthcare. So I must disagree. I have no sense of any swimming in cash, but we have seen, fears of a recession become, more of a soft landing in our economy. That we continue to endure headwinds. The banks are not changing, they're not adjusting the interest rates. We're still, as a nation and in many ways as a world, trying to figure out when we will turn what has been a significant corner. And I certainly am of a fiscal philosophy that being cautious will always manage to serve us well. In Lunenburg, cheapness is a bona fide, I guess, but being cautious, not getting ahead of yourself too much in spending. In terms of the impact of a proposed reduction in HST on an industry like tourism, as you mentioned, tourists don't make decisions based solely on something like sales tax. We saw that when the provisions in and around American tourists coming and how they used to be able to file to get some of their tax monies back. And so I think there's very, very good evidence to the fact that particularly in tourism and hospitality, that consumers make their decisions based on the product, based on the experiences available. And so I continue as an MLA that represents one of the many, many visitor destinations within Nova Scotia. I continue to believe in the strength of our product to pull us through, and certainly don't believe that a reduction in HST would be the particular salvation of that industry in and of itself. But I will say that tax policy questions really are best directed to Finance and Treasury Board. So these are really my own thoughts.
I recognize the honourable member for Northside Westmount.
Thank you, Madam Chair. I'm not talking policy, really. I'm just talking about what you feel as Minister of Economic Development, a 2% cut or $500 million would mean for the business community, which you represent as Minister of Economic Development, what that would mean for their ability to grow their businesses, to become, have greater sales, to find new markets, to hire more employees, to pay a better wage, all of those things that you talked about earlier in your opening remarks. So do you believe a $500 million influx into the economy of Nova Scotia, would it be a good thing or a bad thing?
I recognize the Honourable Minister for Economic Development.
Thank you, Madam Chair. Excuse me, thank you for the question. I think that while tax cuts generally are something that people like the idea of, that they might reasonably welcome, that when we look at the impact of a 2% reduction in the HST, $500 million, that there are many ways that we can support businesses in a more economical way. As a for instance, some of the programs that I've already referenced, like IRP or the Export Development Program, our incubators and accelerators. It costs $10,000 to support a startup at the Mara Idea Hub. And you have both the promise of a business that grows and employs and creates wealth and from it taxes, but also that so many of these startups are focused on ideas that address some pretty big problems and challenges in our world. So at the same time, to remove $500 million, a block as large as $500 million from our budget as revenue, would have material impacts. I mean, that is a big figure. Material impacts on our ability to serve students, to serve patients in our healthcare system. So I think it has to be looked at in the fulsome context of might that, I think anytime there is more discretionary income in a household, one hopes that that triggers additional economic activity, additional spending. At this moment in time, with the inflationary pressures that people are feeling, I think it's going to take something substantive to remove the fingers and get the blood back in the knuckles. But in the meantime, I feel confident that Nova Scotians are with us on many of the investments that we are making in areas like healthcare, in areas like schools, and things like our new universal lunch program. So while I would never say that it would be unwelcome, I think the scale of a $500 million, we can help businesses in many ways at a substantially lower investment.
I recognize the Honourable Member for North Side Westmount.
Thank you, Madam Chair. I'm going to switch. I think every Nova Scotian would welcome a 2% reduction in the tax that they would have to pay. It would be much more of a significant savings for them than the indexing tax brackets. I don't think it's an or, I think it's an and. Indexing the tax brackets and giving a nice 2% reduction in HST would go a long way in giving a little boost to the economy. But my question at this point is, what are you hearing from small businesses about this potential cut or this idea of a 2% cut in the HST? Is it a favorable response that you're getting from small business?
I recognize the Honourable Minister for Economics.
Thank you, Madam Chair. The plain, honest answer is that I have not had any interactions on that particular proposal. It may be that it's new and still being socialized. I mean, we're in regular contact with groups like CFIB and so forth. It simply hasn't come up yet. I will add that I trust that every Nova Scotian is going to appreciate the bump in their paycheck next January that will result from indexing. And that we hope that other factors within the economy are also easing by that time. But again, some of that is for economists and fortune tellers to be able to figure out.
I recognize the honourable member for North Side Westmount.
Thank you, Madam Chair. Do you have an idea of what that bump will be in the average Nova Scotian paycheck from the indexing of tax brackets?
I recognize the honourable minister for economic development.
Thank you. I would have to defer to finance, but I do know that they have information in terms of what that would look like.
I recognize the honourable member for North Side Westmount.
So specifically, when we talk about young Nova Scotians, can you give us an idea of what your department is doing to help them build a future for themselves in this province?
I recognize the honourable minister for economic development.
Thank you, Madam Chair. We are at a point, and I know many of the people in this room, not to be ageist, but a number of us are the age of having grown children or young adults in our lives. And what an extraordinary moment in time to have an economy and a population growing, to have such high demand. It's actually something that's not a plus for many employers, that they having, it's a very tight labor market, and they're having to sharpen their pencils and provide better wages or related incentives to get people in the positions they need. But certainly there are more opportunities for people, but particularly for young people, to stay and work in this province more than ever before. And I look to a company like Cognizant, which was mentioned before, but the same is true for a number of certainly our ICT businesses. They are keen to hire the new graduates coming out of our universities and out of our community college programs. Our payroll rebate agreements further place an additional premium on hiring these new graduates, because though I will always say, living as we do in a democratic country where people, not just young people, but particularly young people, you think, follow your dreams if your dream takes you elsewhere. But the fact that perhaps for the first generation in a long time, that they don't have to leave this province to pursue careers and opportunities in numerous professions or areas of expertise. We have a number of programs through the department that support and work with young entrepreneurs. Certainly our various incubators and accelerators for startups, but we also support Futurepreneur, which is a program that works with young people to mentor them in business endeavors, and is specifically aimed at the 18 to 35-year-old. Not every person is an entrepreneur or wishes to own a business. We have programs like most that are financially incenting Nova Scotians to consider the trades, or if they have completed and have their certificates in hand, to stay in this province looking for work, as opposed to perhaps the sort of the mass exoduses we have seen in the past, where young people headed out to Fort McMurray because they could make that much better money in a short span of time. On Friday for International Women's Day, our department will be at a breakfast, and we have a young woman who is a current participant in the Junior Achievement Program who will be joining us. So there are a number of of ways that our department and our colleagues in other departments, and particularly LSI with workforce development, where we are working to connect Nova Scotians to the opportunities that are all around them in the economy, and as well to put on their radar that very real ability that should they have an idea which they wish to pursue as a business, as an entrepreneur, that there are supports for them there as well.
I recognize the honourable member for North Side Westmount.
Thank you, Madam Chair. Minister, you mentioned a couple of opportunities for students and young people, an organization, I think Cognizant is the name. So just out of curiosity, what would the starting wages be for a young person coming out of school and working at these 1,000 jobs? What what kind of salary would it be? Is it a salary enough that a young person can start their career and afford rent and afford homes and those types of things?
I recognize the Honourable Minister of Economic Development.
Thank you, Madam Chair. Thanks for the question. So with a company like Cognizant, their median income as part of their agreement is $80,000, although they are moving more towards 90. But somebody coming in and just starting, it would be in the vicinity of 65,000 or higher. So when we look at broadly where incomes sit in Nova Scotia and what I think of as this very troubling chasm between lower income and what the progress we're making in sort of the higher incomes, I would say that they're definitely in the upper middle range for those ICT, fintech positions.
I recognize the Honourable Member for North Side Westmount.
Well, that's good news because, you know, when we're moving towards growing a sector like that to attract young people, so that's good news. I'm assuming that company is based here in Halifax. What can you tell me about the rest of Nova Scotia, so rural Nova Scotia? What are you doing for young people, attracting these types of jobs? Because these types of jobs, if you get a company to set up, say, in the South Shore or Cape Breton, where the housing market is hot, but not as hot as it is in Halifax, what are we doing for more rural young people?
I recognize the Honourable Minister of Economic Development.
Thank you, Madam Chair, and thank you to the member for the question. Certainly, as an MLA that represents a rural area of the province and on the South Shore in particular, we're told we have one of the oldest and most aging populations, and I've often remarked that the establishment of HB Studios in Lunenburg, now it would be getting close to 20 years ago. At first, their premises that they had, they work on computers, so the blinds were closed all day long, and small towns, we like to talk, and you see these young people going in and out of this place with all the blinds closed. Well, you can imagine there was all kinds of stories of what must be going on in there, but the thing that we all noticed was that there were young people who were going in and out of there, and to this day, within the businesses in the town of Lunenburg and environs, that is the gaming industry is a young industry, and that has a real, in terms of having a robust community with multi generational residents, that is a very valuable and happy thing. Again, one of our most successful tools in terms of offering opportunities in rural areas, but including, to your specifics of your question, opportunities for young people in rural areas, has to do with the investments that are made possible through the Innovation Rebate Program. So we have a province, we have a country in Canada that falls far behind most of the G8 nations in terms of productivity, and we have a province that falls on the wrong end of the scale within Canada as well. So the Innovation Rebate Program helps to de-risk investments in technology, in new processes, to move businesses along, make them more efficient and competitive, and very, very often also greener. The impact of this is to provide more sustainable jobs that tend to have better wages, but the added attraction is we often see people, this is a well-documented fact, we see people coming out of programs at NSCC, and they are looking at potential employers, and they will say, like, they don't want to work on that old equipment because they're training in NSCC, and to the credit of NSCC that it's keeping abreast of new processes, equipment, machinery, and so forth. It becomes a compelling recruitment tool when a company invests in perhaps that new robotic piece of machinery to cut steel. I've literally seen this in my neck of the woods at Abco Industries. It's young individuals, men and women. I'd bet that they're 30 and under, but they're certainly under 40, who are the people who are attracted and are filling those jobs. I think to the investment that's being made by Michelin, particularly at the plant in Bridgewater, where they are spending $300 million so that they will be building the tires of tomorrow for EVs, and a very increase, like a workforce that is multi-generational. And we know that we have, in addition to the tight labor market that we have right now, we have a generation of people who are hovering on the cusp of retirement, some of whom have delayed retirement because they understand that their employers may be hard-pressed to replace them in the short term. We have organizations like Ignite that has facilities in Yarmouth and New Glasgow that are working with entrepreneurs in terms of some innovation spaces. So we do have innovation spaces outside our urban areas, and even things like the reactivation of gypsum mining at Little Narrows, which is still in an early stage, but providing opportunities for young people to connect to jobs with a good income and living, and be able to stay in this province or come to this province, which is the other piece. I remember being at Meta Materials more than a year ago when they opened their new facility in Dartmouth. And their staff, again, they skewer to what I think of as the younger, increasingly I think of as the younger side of the scale. But talking to people that day and asking how long they'd been with the company and where they had come from, and meeting people from all parts of the world, certainly all parts of Canada. But I remember one young woman in particular who told me she was from Calgary. And I said, you know, there must be companies in Calgary working in nanotechnology, which is, you know, the basis of the developments at Meta. And she said, well, yeah, there absolutely are, but this place was the most exciting place. So that was an example of a young woman who told me she came here on the strength of her job opportunity with her partner, and did end up buying a home outside of Halifax. They did end up, she was quite forthcoming with the details, but that she had was a fairly new homeowner of a property near Hubbard's, and based on her experiences in Calgary, that a 20-minute commute suited her just fine. So I think there are those opportunities, but I would certainly acknowledge that in terms of creating compelling opportunities for young people, it can be certainly more challenging when you get out to the most rural of our rural areas.
I recognize the honourable member of Northside Westmount with a note that there's 3 minutes remaining.
Thank you, Madam Chair. Your government has stated, and there was a great segue of bringing people here to Nova Scotia. So the government has stated that the goal of doubling Nova Scotia's population by 2060. What is your department's plan to invest to sustain this rapid population growth from an economic development standpoint?
I recognize the Honourable Minister for Economic Development.
Thank you, Madam Chair. Thank you for the question. We have a couple roles in this regard. One is that economic development is part of is a player in achieving the goal of the population increase. And
Order. The time allotted for the Liberal caucus is now expired. It is now time for the NDP. I recognize the Honourable Member for Halifax Citadel Sable Island.
Thank you, Madam Chair. So maybe with the few minutes I have tonight, we'll continue talking about Cognizant and the payroll rebate. So how was this developed? So did they come to you looking for a payroll rebate, or were you out seeking companies to support?
I recognize the Honourable Minister for Economic Development.
Thank you, Madam Chair. Thank the member for the question. I did want to double check my facts. In the case of the Cognizant opportunity, we were alerted to the opportunity by someone who is a native Nova Scotian who has worked in this particular sector with other firms here. He alerted us to the opportunity, but it was a competitive situation. So those first agreements in particular, Cognizant was already, continues to have a location in Ontario, and we're already established there. So, there was a certain sense that among the field of competition was just to continue an expansion at that site. Other provinces were also keenly interested. So I just want to emphasize that it was a competitive situation, but they saw value not simply in the rebate, but again in Nova Scotia's talent pool, which is more and more an important factor.
I recognize the Honourable Member for Halifax Citadel Sable Island.
So payroll rebates as an economic development tool, we've used them a lot over the years in Nova Scotia. And I guess I feel like they've had a mixed record. So certainly, I think most companies have completed whatever 5-year deal we have and that sort of thing. But, the one, we've put, as Nova Scotia taxpayers, millions, hundreds of millions of dollars into companies that pretty soon after the rebate ended pulled out of the province. So I'm wondering, has the model for negotiating a payroll rebate changed in the last couple of years, especially given the changing economic situation that we're in?
I recognize the Honorable Minister of Economic Development with a reminder that there's 5 minutes remaining.
Thank you, Madam Chair. And thank you for the question. And I think one of the critical things that I want to pick up on, because you asked about a model change, and there has been a model change, and I would say there's even in the time that we've been in government, a tweaking of the model. So in the earliest usages of the payroll rebates, they were used in some cases for what we would term a call center. Many things still get called a call center, but a lot of what we are now seeing, certainly what we are supporting with payroll rebates, are business centers. They sometimes get called innovation centers, but a much higher, first of all, a higher level of skill that the employer is looking for to hire, and with it, higher salaries. So salaries that are usually in excess of $70,000, and more often, particularly in ICT, are in the $90,000 to $106,000. So I think in the colloquial Nova Scotian way, they're good jobs, certainly in terms of the remuneration. But I think the other thing that's really important to point out is the payroll agreements, these are rebates. So no money, certainly we have seen in the, now moving on to a more distant past, but you know, the incenting of businesses to come to Nova Scotia, wherein extraordinary investments were made up front, and where in some cases, you know, companies stayed X number of years and felt like they disappeared in the night sometimes after, you know, these, in spite of these investments. With payroll rebates, the employment must, they cannot seek the rebate until the employment is created. There are thresholds which they must meet, and if they do not meet those thresholds, they may not get, they in some cases, we saw this during the pandemic, where the disruptions of the pandemic created what may have been considered reasonable barriers to accelerating their growth in the way it's first predicted. So there's a mechanism for reasonable considerations, but if they do not meet, generally if they do not meet those targets, they are not able to collect the rebates. So in all cases, the payroll taxes that would be remitted to the province well exceed these investments. We do also increasingly use the negotiation period to in any way incent things that align with our goals. So the hiring of immigrants, or the hiring of new graduates. You know, we definitely try in...
Order. That concludes the subcommittee's consideration on estimates for today. The subcommittee will resume consideration when the House again resolves into Committee of the Whole on Supply. Please return to your seats in the Legislature chamber. The Committee of the Whole must rise and report before the House concludes its business for the day. Thank you.